to 89.7 WGBH HD1 Boston. Online at gbhnews.org. GBH News. What matters to you?
I'm Jim Browdy. In the 11 o'clock hour BPR, Defense Secretary Pete Hegseth is in hot water as lawmakers from both parties warn that he may have committed war crimes in those strikes against boats off Venezuela when he issued a follow-up order, quote, kill them all. We'll open phone and text lines first. Epstein, now this is the end of Trump's stranglehold on American politics at hand.
I'm Marjorie Egan. Then Massachusetts is considering new regulations for elderly home care. We'll talk with Mass League of Community Health Centers' Michael Curry about that and the latest on rising health insurance costs as Affordable Care Act subsidies sunset. It's all ahead, 11 o'clock hour, BPR, GBH, and NAPM.
Live from NPR News in Washington, I'm Corva Coleman. A federal appeals court has ruled Alina Habba is not serving lawfully as the U.S. attorney in New Jersey. NPR's Carrie Johnson reports on the latest challenge to the way the Trump administration is installing federal prosecutors.
The three-judge panel for the U.S. Court of Appeals for the Third Circuit unanimously ruled Alina Habba is disqualified from supervising cases. The court found Habba had been put into the U.S. attorney job in New Jersey in an unlawful way. The Trump administration's been frustrated in advancing some of its nominees for those top prosecutor jobs, but the court said people in New Jersey and loyal workers at the Justice Department deserve some stability and clarity. Similar challenges are underway to Trump prosecutors in California, New York, Nevada, and Virginia. A court there dismissed indictments against former FBI Director Jim Comey and New York Attorney General Tish James based on the appointments issue. Carrie Johnson, NPR News.
The man accused of killing the CEO of United Healthcare last year will begin a series of hearings today. Lawyers for Luigi Mangione are asking a New York state judge to throw out some pieces of evidence in the murder case. Mangione also faces federal charges in the matter. If he's convicted, prosecutors could seek the death penalty. Israeli Prime Minister Benjamin Netanyahu is seeking a presidential pardon. He wants to end his corruption trial without pleading guilty or leaving office. He says he's in court 3 days a week, and a pardon would be for the good of the country. NPR's Daniel Estrin says Netanyahu has been fighting the corruption charges for years.
Well, it's really a pivotal moment for him. He's facing an election year coming up next year. He's facing a lot of discontent at home. There are calls in Israel to launch an official inquiry to hold him accountable for the security failures of the Hamas attack, October 7th, 2023. And at the same time, his corruption trial has shifted into higher gear.
NPR's Daniel Estrin reporting. The White House is reopening for public tours after a 3-month hiatus. As NPR's Tamara Keith reports, the residence is decked out for the holidays, but the footprint of the tour is much smaller than it was previously.
Tours used to start in the East Wing, but it was demolished to make way for President Trump's ballroom project. The tour now sticks to the state floor of the main residence. The theme is Home is Where the Heart Is, and the official White House Christmas tree features gold stars to honor families who lost a loved one in active duty military service. Nicholas Clemens works for the First Lady.
There's a lot of meaning, especially with putting the Gold Star families here at the heart of the White House, here in the Blue Room, showing that they're front and center.
There's also a 6,000-piece Lego portrait of President Trump and another one of George Washington. Tamara Keith, NPR News, the White House.
You're listening to NPR News.
Good morning. With the latest from the GBH Newsroom, I'm Henry Santoro. It's not only gift-giving season, but it's also Cyber Monday, the busiest online shopping day of the year. Control, Alt, Spend. And pediatric health officials have a list of toys that shouldn't be under every tree this year. Amy Watkins leads Connecticut Children's Hospital Injury Prevention Center, and she says e-bikes are one gift that should not be taken lightly.
E-bikes come with some unique risks that standard bikes don't, such as that they're much faster, they are heavier, they're a little bit harder to maneuver.
Officials say other dangerous gifts are stuffed animals or technology that use AI to interact with kids. They say the toys can expose children to explicit and inappropriate content. And remember that sperm whale that washed ashore on Nantucket last month, the one that was towed out to sea? Well, inquiring minds wanted to know how much it cost to tow the 52-ton mammal 50 miles offshore. Nantucket Current reports the operation that cost the town $24,500, something a town doesn't necessarily budget for. But that figure is likely to be offset by nearly half thanks to an offer from the owner of the property where the whale washed ashore. The owner just happens to be Paul Salem, the chair of the Board of Trustees of the Woods Hole Oceanographic Institute, one of the world's leading nonprofits dedicated to ocean science. What are the odds of that? Monday Night Football, Patriots host the Giants at Gillette. Parking lots open at 4. It's Cyber Monday, 40 degrees. This is GBH News.
Support for NPR comes from NPR stations. Other contributors include Imaginable Futures, funding programs in the U.S. with the goal of ensuring young children and their parents get the education they need to thrive. Learn more at imaginablefutures.com. This is NPR.
He's Jim Browdy. I am Marjorie Egan. You're listening to BPR and GBH and NEPM, streaming at youtube.com/GBH News. We'll be back at the library tomorrow. We hope Jim can be there. He's courageously broadcasting from his boudoir today because he has COVID, Jim. I'm sorry about that. But we hope you're going to be well enough to join us tomorrow. We're also going to be, Ethan Hawke, the great actor, is going to zoom in. CNN's John King is going to join us at the library, as well as Boston Pop's conductor, Keith Lockhart. Jim, I hope you feel better soon.
I do. And while, having COVID is obviously a negative, a real positive is we are only 3 months to the day from the beginning of meteorological spring. So that's the approach that I am choosing to, whatever. Okay, yourself. So Thanksgiving is over. We hope everybody enjoyed that. On Friday, the Washington Post published exclusive reporting about U.S. military action in the Caribbean, revealing that Defense Secretary, or Secretary of War, as he likes to call himself, Hegseth, called for Navy SEALs in a follow-up strike to leave no survivors in their attacks on vessels they claim are ferrying drugs into the country. The increasing U.S. military presence in international waters started in early September. The new reporting shows that Hegseth gave the directive to kill everyone on board in that very first boat strike. The Trump administration has yet to provide any evidence at all to the public that these strikes are actually targeting drug smugglers. And even if the intelligence proves legit that they are, killing these traffickers could amount to war crimes. And by the way, that's not my own occasional hyperbole. That's some lawmakers on both sides of the aisle. So the lines are open at 877-301-8970 is the number. Republicans and Democrats, some at least, are standing together on this issue. Second time of late. Obviously, Epstein was the first. Are we witnessing the beginning of the end of Trump's stranglehold on American politics? Or does this cat have 9 lives? The number is 877-301-8970 is the number. What do you think? I mean, this is pretty serious stuff.
You always think that. Well, I've always thought anyway that this is the last straw. I don't know if this is the last straw, but as you mentioned, the combination of this with Epstein, I think it's really uncomfortable that we don't really know who these people are that have been slaughtered in these boats. I think a lot of people are not very confident in Pete Hegseth. I think it's very odd that we don't have name, rank, and serial numbers of the people. This is not fentanyl, as many people have observed, that's being interdicted, however you say that word.
That's a word.
It's cocaine. And if, in fact, it is cocaine, and I think obviously cocaine's a problem, but fentanyl is a bigger problem in terms of killing people. So I'm suspicious. I think a lot of people have been suspicious of this whole thing. And when you find out, according to the Washington Post, who got this from 7 people, all told, that Hegseth said, kill the people that are clinging to the boats back in September. I don't think Hegseth is a reputable person. And so I don't believe him. I would believe the people that spoke anonymously to the Washington Post. And I also think it's very interesting. We've never heard from the admiral who was in charge of that whole operation.
Who quit.
Who had a long
Very good
career,
point.
long distinguished career, and he quit. Why? I don't know, but we never got an answer to that. And there's been a lot written about people in the military keeping their heads down because they have seen what happened to people like Mark Kelly, who didn't say anything that was out of line about not rejecting illegal orders, because that's the fear here. This is an illegal order that they're following from Hegseth. So they're keeping their heads down, and that maybe more people in the military would speak if they didn't think that they were going to be attacked by Hegseth and the Pentagon and the Justice Department.
The most significant part of this is that Democrats and Republican leaders of the House and Senate Armed Services Committees are saying they want an investigation. It is rare for Republicans to have that courage. But, one of the things we find through the... what are you motioning about, by the way? That's an excellent motion.
I can't see both you and the text. That's what I'm motioning about.
Well, here I am, Marjorie.
Yeah.
I'm sitting in my boudoir.
Apparently we could only see the
out
top
here in
of
Cambridge.
We could
No,
only see the top of your head. Oh, did you fix that?
I think I fixed that. Now you can
well,
see my whole head.
I can't see you, so I can't see you at all.
Whatever. Okay, fine. There's Jamie. He's fixing
Jamie's coming to rescue me.
Again, the issue is when you tie this to the near unanimous support. Admittedly, once Trump said it was okay for them to do it because he knew he was going to lose the vote on the Epstein documents, the fact that there are going to be hearings into this. Think about this for a minute, by the way. Apart from what Marjorie said about no evidence that these are drug smugglers, we're not in an armed conflict with these people. So the underlying acts may be illegal, but the Secretary of Defense is reported to have said, kill them all in a follow-up. 2 people were allegedly holding onto the side of the boat after the first bombs or whatever they used were dropped on these people. And let me tell you one other thing. To show, in addition to the lawlessness of this administration, what a fraud Donald Trump is, at the same time that he is dropping weaponry on these boats in the Caribbean with no evidence about what they're doing. He just pardoned the Juan Orlando Hernandez, who is essentially works with El Chapo, who everybody has heard of, who was just sentenced to 45 years in prison.
He was supposed to die in prison.
For his drug shepherding. He is pardoned, but we're dropping bombs on these people in the Caribbean. The guy is a total fraud. The number is 877-301-8970. The question, I guess, is for all of you at 877-301-8970, is this beginning to cause the Teflon on Donald Trump to disappear? I think the answer is yes. I think he's in deep trouble. His approval rating is the lowest it's been in the second term, 36%, which is virtually nothing. And so I am hopeful that this could lead to more Republicans doing the right thing on everything.
By the way, before we get to the calls, when Jamie was in here fixing the text, I may have missed if you said this, Jim, that this Todd Huntley guy, former military lawyer who advises special operation forces for years, he said that because there is no declared armed conflict, killing these people on the boats
I did say that
amounts to murder. But he goes on to say that even if the United States were at war with the traffickers, in order to kill all the boat's occupants, if they were no longer able to fight, as obviously they weren't if they were clinging to the side of the boat, would in essence be in order to show no quarter, which would be a war crime. So it seems to me that Mr. Hegseth is on very shaky grounds on a whole host of areas.
Also when Trump and Hegseth post these videos of this thing, you can see it's like little boys playing this macho game. The only problem is they're killing. What is it, 80 people they've killed now? And it's time, and I think the time has come for the Republicans to stand up. We shall see. 877-301-8970. Are you as optimistic, which I never am, as I am about the fact that Trump is finally wearing thin, even on his sycophantic fellow Republicans?
Let's go to George in Rhode Island. Thank you for calling. Hi.
Hey, George.
Hi. I just want to say that most of us don't know much about POWs and the rules of war at sea, except there is a 1940s Hitchcock movie called Lifeboat, during which time most of the people are British and they're in a lifeboat for almost the whole movie. And toward the end, and they're at war, England and Germany, and they're at war. And at the very end of the movie, they see a boat coming, and they all believe they're going to be rescued. And then they go, "Oh no, it's Nazis. What are we going to do? What's going to happen to us?" And someone says, "Don't worry, they can't kill us because of that rule, and about you can't do that to someone who's survived. They'll take us aboard and they'll feed us. At worst, we'll be POWs." So that's my affiliation with the rule, and it goes back that far.
Well,
I don't think we need to depend on Alfred Hitchcock, even though that I didn't see that one, but he was a great filmmaker. I think there is near unanimity that if this Washington Post reporting is true, that Hegseth is in real trouble, not to mention the United States in general being in real trouble for attacking these boats without us being engaged in an armed conflict. Thank you for your call, George. We appreciate it.
Here's a texter who says, Pete could soon find out how fast Trump drops people he thinks make him look bad. These leeches think if they're loyal to Trump, then it's going to be reciprocated. Never is. That's from Aaron in Hopkinton.
You know, can I ask you the question I ask you almost every single day? Do the 36% who still support Trump pick up on the fact that he is allegedly bombing these boats because he's so concerned about drugs at the same time that he's pardoning this guy who was scheduled to do 45 years in jail for his involvement with El Chapo?
And you know what's clear? Why is he doing this? I know Roger Stone is a fan of this Honduran.
Well, that's good enough for me.
Guys. Is that it? Is there some money to be made here? I don't get why he's doing this, and especially when it was such a devastating blow to all the prosecutors who thought they'd won this great case, and most of it was put together during Trump's first time around. It wasn't a Biden thing. So I don't get it, but lunacy is how it's being characterized by people from the U.S. Attorney's Office for the Southern District of New York. What?
He's the former president of Honduras. I should have mentioned.
Oh yeah.
That.
I'm sorry. I must have missed that. So maybe
he was I don't know enough to know. Maybe he was a strongman kind of leader, and as we know, Trump loves those strongman
the only thing
kind of guys.
Well, maybe that's it, because apparently the government is now more liberal, and maybe that's the problem. But it seems kind of a weak link to pardon a guy who's sentenced to 45 years. Anyway, let's go to Jason in Cambridge. Hi, Jason.
Hello, Jason.
Good morning. Good morning.
Hi.
I actually agree with Jim, about something, but I want to say that I'll preface these remarks by saying I watch a lot of old documentaries of wars that happened, the world wars and Korea and more modern ones, and you see people. You see actual people fighting each other or using weapons or whatever. In these, destruction of boats and people, it's kind of like a video game, and like We Got 'Em. You don't see the people.
That's a great point.
It's very, very abstract, and I think that affects the perception of these murders among citizens and among politicians. It's just it's really vague, and I like black and white documentaries of wars because I grew up watching those. We didn't watch cartoons. But anyway, it's all like really real and eye level and human. And the tragedy is visceral and very apparent.
I think that is a brilliant point, actually.
Yeah.
Really a brilliant point.
You heard about that with the drone attacks in Iraq and Afghanistan, the toll it was taking on the people that were sitting in a basement somewhere, orchestrating these drone attacks, that even though it goes a little bit opposite to what the caller was just saying, that it did take a terrible toll on their mental health.
Well, also an opposite to what the caller said, but there's a reason for it, and because I agree with everything he has said in terms of these bombing of these boats, that's essentially what's happening in Ukraine from Russia.
Right.
The difference is we see the after effects of those drones, those non-human attacks, almost immediately. So I think that causes them to be more real. But he is so right. When you watch these videos, when they're posted by Hegseth and Trump, doesn't it have that video game feel to it kind of thing?
Yeah, and you see them over and
does.
over again. Pete in New Hampshire thinks Democrats are defending drug cartels because of their Trump deranged syndrome. But I would ask Pete in New Hampshire, why do you think they are drug cartels? Where's the evidence? That's the problem. We don't have evidence that they're drug cartels. That's just what they're saying, and I don't think this is a truthful administration. Here's Amber in Worcester.
Wait. But even if they are drug cartels, does anyone who is sane argue that bombing them is a legal act by the United States?
What the Coast Guard used to do is they would intercept the boats and arrest them. I mean, we don't go into in the United States, whether it's cocaine or fentanyl or anything else, and shoot them, you're supposed to, arrest them and bring them to trial. So that's the other issue, too. But that's what Pete in New Hampshire thinks.
I
Anyway,
interrupted you. What are you saying?
Here's Amber from Worcester. As the wife of a combat veteran, this story broke my heart and made me sick to my stomach. I was literally shaking and crying, thinking that our soldiers could now be prosecuted for war crimes because of being forced to follow murderous, unlawful orders from an egomaniac with no experience, no remorse, and no soul. And Amber is bringing us to what the Democratic Mark Kelly and the other group of veterans who sent a message to veterans saying you should not follow illegal orders. I think they were talking about this, and they were talking about going into the cities of the United States, but I think they were talking about clearly, don't you think, talking about these attacks on these boats with people that we don't really know who's in them?
By the way, can I tell you, Marjorie, considering I am in my boudoir, I can't see the clock, so it's all on you.
Oh, okay. I'm watching the clock. I can't see you either, Jim. You can't? No, but that's okay.
Why can't you see me?
I don't know.
I see me.
Well, you see you. But as long as you see me, I guess that's okay. 877-301-8970. Jane in Concord, thank you for calling.
Hi, Jane.
Hi, Jim.
Hi.
I hope you didn't catch COVID for Thanksgiving. And I hope you recover quickly.
Thank you.
I understand Jim was the patient zero for a super spreader event.
I've had it like 5 times, even though I've had 1 million shots, by the way. But I haven't been hospitalized, so you anti-vaxxers, don't rejoice.
Yeah.
Go ahead. Thanks.
I had a couple of thoughts. One is drug kingpins or bosses are not on those boats. I mean, we're talking about a tiny, tiny drop in the bucket. Even if those were drug boats, it would be like a little minuscule amount. So if you're looking to find out who's in charge, you don't blow up all the people. That might give you some information. And the other thing is Trump keeps saying, I just want to stop the killing regarding like Ukraine or Gaza. So how is this consistent with his anti-killing and peace plan to be basically warmongering against another country with a ridiculous trumped-up reason?
Well, if you want to make me happy, why don't you add, how is it consistent when he pardons one Orlando Hernandez, sentenced to 45 years in jail?
There's a strategy. We're gonna pardon the drug kingpin, the actual drug kingpin, the ex-president of Honduras, and then we're going to get the little guys in the boats who may or may not be fishermen or may not be actually members of drug smugglers. It makes no sense, Jane. But,
Jane, thanks for the call. We appreciate it. Can I play a little? Do we have enough time for a little sound that drove me out of my mind?
Go ahead.
A lot of the attention this weekend was about the unimaginable killing of Sarah Beckstrom, this 20-year-old National Guards person from West Virginia, and her colleague obviously is in critical condition. Trump is in Mar-a-Lago on Thanksgiving. He's asked if he planned on attending the funeral of Sarah Beckstrom. Listen to the response. Listen to the callousness and cluelessness of the leader of the free world. Here's Trump.
I haven't thought about it yet, but it certainly is something I could conceive of. I love West Virginia. I won West Virginia by one of the biggest margins of any president anywhere. And it's, these are great people. I love the people of West Virginia. I love the people of our country. But I haven't given it any thought, but it sounds like something I could do, yeah.
I may go to the funeral of this 20-year-old who was murdered as a National Guards person who I sent to Washington, D.C. But by the way, no one's ever won West Virginia more than I have. It is so crass and so low is just amazing.
We have quite a few texters who believe that these are, as one of them just said, animals bringing drugs into our country. And again, I would ask you, why do you think that's true?
Ask them another question.
They're buying the line of the administration.
Well, but the follow-up question is, you've asked several times in this segment, if they are, quote, animals, as they say, bringing drugs into our country, does that mean we just execute them like Duterte did in the Philippines with drug people with no apprehension, no trials, no charges, no nothing? Is that what they want?
This person thinks that we're keeping our war fighters sharp, using them as free targets.
That person doesn't. I'm sorry, they don't believe that. I mean, that is trolling extraordinaire.
Well, as the wife of the combat veteran just said, it's not inconceivable that these people following these orders, which are looked to be illegitimate, could wind up getting prosecuted. I mean, that's what's really, it's always the little guys who end up getting prosecuted, you know what I mean? Be nice
No, actually, the big guy, this Hernandez, did get prosecuted, and a jury convicted him, and he was sentenced to essentially life, 45 years, but would have been life, but obviously Donald Trump felt that was an inappropriate
Here's
sentence.
what the judge in the case said. He called Mr. Hernandez, this is the guy that just got pardoned by Trump, the big-time drug guy, a two-faced politician hungry for power who masqueraded as an anti-drug crusader while partnering with traffickers, and prosecutors asked the judge to make sure Hernandez would die behind bars, citing his abuse of power, connections to violent drug traffickers, and the, quote, unfathomable destruction, close quote, caused by the cocaine in which he was trafficking.
So let me ask you.
That's the guy Trump just pardoned.
If El Chapo agreed to build a bunch of Trump hotels in Mexico, do we pardon him too? I'm serious.
Well, this Hernandez guy, they accused him of taking bribes from El Chapo.
I know.
So I don't, it's a little confusing. So the gentleman that was okay with him taking the drugs from these animals, you should text back and say if you're okay with him also pardoning a convicted by an American jury, a drug trafficker who was sentenced to 45 years, which is no small amount. Let's go to Steve. No, we have to go in a second. Well, Steve, if you want to talk really quick, we can squeeze you in, but you only got about 30 seconds. I'm sorry.
Yeah, hi. Steve, retired Coast Guard officer, 25 years experience. So,
you know what, Steve? We should wait. We should wait to get you after the break, because I want to talk to you for more than 30 seconds if you're a retired Coast Guard officer. Would you mind holding on through a quick break?
No problem.
Okay.
Thank you.
Okay. Thank you very much. We are going to take a quick break right now. We're talking about the campaign of Pete Hegseth at the Pentagon, which the president has approved of basically blowing up people that are on boats in the Caribbean that they say are carrying drugs. We've had no proof or evidence of that, and now we know that Hegseth allegedly wanted to kill two people that were clinging on to a boat that had already been blown up back in September. I'm Marjorie Egan. He's Jim Browdy, forging ahead despite having COVID. You're listening to BPR and GBH and NAPM, streaming at youtube.com/GBH News.
Shenzhen is a sprawling city in China, home to more than 17 million people. Just half a century ago, though, it was completely different.
At the very beginning, it's a very small village, actually. There's not a lot of people living here.
We look at how Shenzhen grew so quickly and whether that growth is sustainable. Next time on The World.
This afternoon at 3, here on GBH News 89.7.
Our programs are made possible thanks to you.
And the Isabella Stewart Gardner Museum, honoring Boston's own artist Alan Roane Crite and the neighborhoods he depicted in concurrent exhibitions with the Boston Athenaeum. On view through January 19th. More at gardnermuseum.org.
And Bonsai Bar, hosting pop-up beginner bonsai workshops at breweries across New England. Hands-on classes provide guidance in the basics of bonsai design and care in a group setting. More at bonsaibar.com.
Welcome back to BPR and GBH and NAPM. Marjorie Egan and Jim Browdy. We're streaming youtube.com/GBH News. We're back at the library tomorrow. CNN's John King will zoom in. Actor Ethan Hawke will zoom in. And Boston Pops conductor Keith Lockhart will be there in person. If you're just tuning in, we're talking about the bombshell, horrible choice of words, well, maybe not, reporting from the Washington Post this weekend, charging Defense Secretary Hegseth with essentially committing war crimes in the U.S. military's boat strikes in the Caribbean. Republicans and Democrats are both calling for congressional inquiries and more oversight into the Trump administration administration's actions. So this paired with Epstein, our underlying question is Trump's stranglehold on American politics loosening? 877-301-8970.
Let's go back to Steve in Daytona, I think. Thank you for calling.
Hi, Steve.
Sure. I've got a real problem with what's been happening from the first vote. I think this is the red line that he crossed that exceeds any other red line. I've spent 25 years in the Coast Guard and off and on was involved in the diplomatic side of getting permission to board vessels at sea and the processes that the Coast Guard uses. And the one thing I really wanted to point out is I never encountered a cartel member on a boat. The people driving those boats were coerced, poor fishermen whose either families had been threatened or they were just desperate for the cash. They really were given no choice to do it. Maybe some low-level cartel members for security, but you're not going to find El Chapo in these boats. You're not going to find big quantities of drugs on Venezuelan vessels. I've never stopped a Venezuelan vessel in all the years I was doing this. I mean, we all know now this is a pretext for something else, or it's tough guy talk or whatever. But the thing that really pushed me over the edge is 80 people murdered from my perspective. You don't gather intelligence from dead people, which helps you continue that cycle of figuring out which boats actually are smuggling drugs. But from a Coast Guard perspective, where we also had a search and rescue and humanitarian mission, if ever there were two people at distress in sea, particularly people we put in distress, i.e. the two survivors hanging on to this vessel, killing them is just raised this to another level. It was murder before, it's murder now, but I don't even know how to describe that. In 25 years in the Coast Guard, I dedicated, and my colleagues dedicated their lives to saving lives, even if it was a bad guy. And I did this in Miami, and we put as much effort into saving a smuggler in distress as we would your father or your brother who was in distress. That's our job. That was the core to who I am, and this just makes a mockery of that. So I'm happy to answer questions about the process, but probably been talked out.
No, I do have a couple of questions. I wonder if you think that was the message that Mark Kelly, the senator et al., were sending to people who might be associated with this in the military, that they shouldn't follow these orders because they're illegal.
I think that was the root cause of that particular commercial and of what Mark or Kelly was saying. And quite frankly, the UCMJ, which is what Hegseth is threatening to prosecute Kelly under, is where you find that illegal orders are illegal. So it's the same code of law. And he said nothing. Kelly said nothing that any military officer or military member would not understand. I do understand it's tough if you're a commander right now, because there is nothing immediately to be gained by ignoring the Secretary of Defense's orders. You're going to be cast out if you do that right now. So it's a really tough position to be in. And quite frankly, as you said before, Marjorie, I really hope there's a way to protect some of these guys who really had very little other choice.
Yeah.
They did have choice, and they could have walked out like Admiral Woolsey did, but it's tough when you're on the spot. And I don't want to put myself in their shoes. But Hegseth should be prosecuted.
I do want to, if I may, I would like to put you in their shoes for a second. What would you, by the way, this is a really helpful phone call for all of us, and we really appreciate your time and your service. What would you have done had you been the middle person in this Hegseth order?
I hope I would have refused the order. I hope I would have understood that that was probably going to be the end of my career. I don't know if I would have been that courageous. I like to think I would be that courageous. And the most explicit, Jim, is, all right, we bombed this boat. I haven't felt good about it. I've been involved in this. And now we have two survivors, and you want me to kill those people. I have to say, I hope I'd have the moral courage to not follow that order at the expense of my career right now. And I think I would have, because I don't think I could have lived with a moral injury that I would have received from killing two people in distress who were not imminent threats. That is so clear cut. So clear cut. There is no reason to do that.
Let me tell you, just knowing you on the phone for 4 minutes, I'm pretty convinced you would have done the right thing, too.
Yeah, I think I would have been happy seeing you come toward me in a boat if I were floating around the ocean. Steve from Daytona, thank you.
Thank you for your call.
Thank you
really
very much
valuable call.
for your call. And we should point out, as Steve said, about the people that are coerced into doing this. Michael is zooming about Wall Street Journal reporting. CNN also did it. They sat down with the family of one of these guys that was killed with the boat, and that's what they were saying, that these were poor fishermen who couldn't make any money. They were pushed into this, coerced in a threatening way, and some of them did it just because they were broke and they needed the money.
Yeah.
So
it's actually Michael Curry who's zooming in. That's what that means.
That was Michael who was zooming in.
Zoe who
okay.
typed us
then
that
it wasn't
note.
Michael, but somebody
Thank
just
you.
talked. Somebody
it was
just
Zoe. We call her
Zoe.
Zoe.
Oh, it was Zoe.
She works
talked
with
about
us.
She talked about the Wall Street Journal. Okay. Well, anyway, both of them did it. The Wall Street Journal and CNN both reported on who was in these boats.
What did you think of that caller just now?
I thought that is a person that I'm very grateful served for 25 years with the United States Coast Guard, and I think probably 99% of the people who serve in our military are very disturbed about this, and they know they have a choice between speaking out or losing their jobs, and I think it's very difficult. Anyway, we're moving on. Up next, we're going to be talking to Michael Curry, the Massachusetts League of Community Health Centers, the real Michael Curry, not the guy that I thought just texted. Also with the NAACP, I'm Marjorie Egan. He's Jim Browdy, bucking ahead despite having COVID. He's listening from home. You're listening to BPR and GBH and NEPM and streaming at youtube.com/GBH News.
Trade. Huge responses from across Europe, from the Danish Prime Minister.
Climate.
Picture this all filled with ice.
Security.
Not only do we need to end the war, we also need to prevent the next war.
These are global issues, and to understand them, you need a global perspective. I'm Carolyn Beeler.
And I'm Marco Werman. Join us for The World each and every weekday.
This afternoon at 3 on GBH 89.7.
Support for GBH comes from you. And Revision Energy, a solar company and a Mitsubishi Electric heating and air conditioning contractor, offering customers the option to combine a solar array with a heat pump system to manage their heating and cooling at home. RevisionEnergy.com. And The Box Center, presenting A Prairie Home Companion Christmas, featuring Garrison Keillor and more, at the Box Center Wang Theater, December 18th at 8. Tickets at Ticketmaster.com.
Welcome back to BPR and GBH and NEPM. Jim Browdy and Marjorie Egan, streaming youtube.com/GBH News. Back at the library tomorrow, CNN's John King will zoom in, actor Ethan Hawke will zoom in, and the conductor of the Boston Pops, Keith Lockhart, will join us in person. We're joined now on Zoom by Michael Curry, who, in addition to being CEO of the Mass League of Community Health Centers and being on the board of the National NAACP, is also sweeping his house as he is talking to us. Your versatility is brilliant, Michael. Congratulations. We're really proud of you.
That was my prediction for the midterm next year.
Very
nice
good.
to see you, Michael.
Very good.
Good to see you as well.
So, Michael, I think we have some good news coming out of the Trump administration, although maybe I'm being premature. But the president has said he may extend the Obamacare subsidies while he mulls his own health care program. I mean, do you think this is legit? And if so, I think it's a good thing.
Yeah, I think it's connected to quite a few things. So one is we know that that the Affordable Care Act is popular even with Republicans, and that people have come to rely on those subsidies to get the coverage. We know that coverage is unaffordable. So for that reason, when you have this sort of unfounded attack on the Affordable Care Act as being a failure, and then for very zealous reasons you want to eliminate the Affordable Care Act, then you are hurting your base. And I think what Trump is realizing that if you don't have another plan, because they've not had another plan. This goes back many years since the Affordable Care Act was debated the first time. There was no, Paul Ryan never came up with a legitimate plan to counter the Affordable Care Act, which expanded coverage to millions of Americans. So that being said, it is absolutely, Marjorie, something he's probably going to have to consider. He really has his thumb on Congress. So if he decides that he wants to extend this for some period of time, they'll do it.
You know, a couple of things here. I don't know if you said the numbers. There was recent polling. He's not doing this because he cares about people who may be denied critical health care. 78% of the American people want the subsidies extended. 59% of Republicans for fairly... But, you know, every time, Michael, I have an opportunity to insert a something that isn't calculable into a discussion like this, the fear that people who rely upon these Obamacare subsidies must be feeling while the three of us are having a conversation, should we believe that Trump's going to do it? We're 30 days away from the subsidies disappearing. And a lot of these people are, and I'm sure you're encountering this much more than we are, 30 days away from people saying, I can't afford healthcare anymore, or if I do afford it, because there are no subsidies, then I'm not going to be able to do X or Y that's critical. That's a huge part of life.
Yeah, it is an unfair choice that none of us should ever be put into, is to decide whether you can pay rent, put food on your table, or provide the coverage you need for any moment where you or your loved ones need access to health care. And unfortunately, we're talking about 22 million Americans are enrolled through the ACA and currently receiving this tax credit to lower monthly premiums. We're basically saying to them, or at least the one big bill is saying to them, that we don't necessarily care about your access to health care. I think this administration has to come to terms with the fact that they are going to be even more unpopular if this goes through at the end of the year and there's no extension. Those are millions of Americans who will see the real impact of this policy shift on their families.
You know, we should say one last thing. The reports are suggesting that if Trump does say to Congress, do this, it's not just going to be an amended extension, but he's probably going to put some poison pills in there that make it really difficult for some percentage of those 22 million people to be able to continue here. So the good news is...
And we'll have another government shutdown probably over that.
Well,
over
that's
it too.
That's going to be a real question for Democrats.
Yeah.
Do they take half a loaf, or do they fight for another full one in light of the fact that the first fight obviously ended in a way that at least Democratic leaders didn't want it to happen? In any case, one last thing. This is the Obamacare thing. Apart from Obamacare, insurance costs for people in Massachusetts are going up pretty dramatically too, no?
Yeah, I mean, we know that I'm an employer, I have over 100 staff that work for me. And every time the summer comes along, we're starting to have conversation around finding insurance coverage from one of our brokers. And we're looking at double-digit increases every year in insurance. Now, if you're an employer, what I want to do is I want to create such a rich benefit that Jim and Marjorie says, I want to come work at the league, and you're going to cover X percentage of my insurance costs, my health insurance costs, and I'm going to choose you, Mass League, over any other employer because you're giving me great place to work and you're giving me rich benefit in your health insurance. What many employers are being forced to do is pass that cost on to you. That if it's a double-digit increase that we're experiencing every year, that where brokers are coming back and say, hey, we couldn't find you anything better. And just to give you a little context, not to get too weedy in policy, that if some of my staff take advantage of their benefits, maybe they get a chronic condition, maybe they have a child, maybe whatever that is, that they're utilizing more health insurance than they normally would, then that rating goes up, that rating is impacted. And then now when the brokers and those health plans come back to me with an analysis of what our insurance rates will be, it's higher. So I say that to say this, that this is a problem now across our health system, not just in Massachusetts. We're facing unsustainable increases in health insurance rates that employers won't be able to pay for, that employees won't be able to keep up with high deductible plans and co-pays and co-insurances. It is deeply concerning. I think we have an opportunity to figure out a way to deal with it, but we haven't cracked the code on how to keep the cost down yet.
Talking to Michael Curry.
May I ask you kind of just a big picture, and it's broad, so we don't have all the details. But I guess maybe the last 30 years, last 40 years, we have seen these astronomical spikes in what it costs for health insurance. Overall, just a couple of things. What are the big things that have raised the prices so dramatically? Is it cancer drugs that are expensive? Is it the last 6 weeks of life cost a fortune, or what is it?
I mean, it probably is. I always jokingly say the answer is D. My kids always laugh when I say that. I mean, it's all the above.
Yeah.
And it's so many things. Pharmaceutical costs are higher. So drugs, more people are living longer and taking more medications, and the cost of drugs going up. You remember a few years ago, we had the issue with the Hep C drug.
Yeah.
And like one pill was a ridiculous amount of money, right? Those are realities of the world we live in now. It's the high cost of people being sick and showing up in emergency rooms and needing very intense acute care in institutions. You know, we have this saying in healthcare, we say we need to see people in the right place at the right time at the right cost. Our system doesn't seem to realize that if we invested in keeping you healthy up front, then we can stave off seeing you sicker on the back end when you're coming into our emergency rooms and having to get stage 4 cancer treatments. We don't do that very well in this country. So it's a combination. Durable medical equipment. It's, the rising cost of goods and services. The workforce costs are higher now. It costs more money to employ people than it probably ever has, particularly in the healthcare sector. All those things, the answer is D, all of the above, and it is something we have to figure out.
You know, following up on your notion about we don't want to see you when you're sicker, we want to see you now. One thing that guarantees that we won't see you until you're sicker is this pharmacy desert issue where people, a growing number of people are so far from explain what a pharmacy desert is and explain if there's a solution to this growing problem, Michael.
It's interesting. We define pharmacy desert in a very specific way. It's your proximity to a pharmacy, and it's different based if you're in a rural area or urban area, or a suburban area, right? It's the ability for you to get to a pharmacy with or without transportation, right? And how is it meeting public transportation or your own vehicle? And we know that the further away that the pharmacy is, the more likely, Jim, it is that you won't even go get your medicine, your prescription filled. And that's the concerning part. The data shows us that the further away it is, you may decide not to go get that prescription. And then again, to Marjorie's earlier question, we're going to see you sicker. They're going to have adverse outcomes for not being treated with that medication. So we have pharmacy deserts here in Massachusetts. Just sharing a few numbers, there are 200 fewer pharmacies in Massachusetts today than there were in 2019. That's 940 pharmacies, down from 1,134. Many of them that are closing are the mom and pop pharmacies that I loved, Jim, growing up, which is you came in and the pharmacist, Jim, would say, "Hey, Michael, you're here for that prescription. Oh, how's your family doing?" Those days are gone and are increasingly gone. And now there's more pharmacy chains that when they have, thin margins, they decide to uproot and leave for many factors. They say theft of their drugs in certain urban neighborhoods, the rising costs of doing business, and then they evacuate our communities. I grew up in Roxbury. We saw the closure of pharmacies in Roxbury. That's deeply concerning because my family members relied on those drugs to treat their diseases, their chronic illnesses. So we have pharmacy deserts. It's a problem. The Health Policy Commission has documented this, and we're going to need to figure out health centers being part of the solution. We need to figure out how to resource health centers to open up more pharmacies like the ones that we currently have across the Commonwealth.
Wasn't part of the solution, in addition to the operation you run, is higher reimbursements for drugs to these pharmacies? How does one make that happen? Can the state mandate that kind of thing, or what?
Yes, it's interesting because there's always a hesitancy of policymakers to mandate reimbursement. We're dealing with that in many areas. I will tell you, for years we would want to mandate the Medicaid reimbursement. Now we have a federal mandate for health centers, not on pharmacy, but just in general, to get reimbursed. But we negotiated historic new reimbursement rates under Governor Baker and former Secretary Mary Lou Sutters, and that was carried over into Governor Maura Healey and then Secretary Walsh and now Secretary Mahania. That being said, we typically think to go to the legislature, if we can't get the private sector to move on increasing rates, then we typically want to go to the policymakers to sort of force the hand of the sector to do that. Now, there's some challenges there. Some folks will not want to put their thumb on the scale and sort of influence market forces. And then in some cases, Jim, you have to do it because you need to do it to preserve the care and the services and the stability of our healthcare system in the Commonwealth. This may be one of those as well.
We're talking with Michael Curry, CEO of the Mass League of Community Health Centers. Michael, I was stunned to learn that Massachusetts is one of only 4 states that doesn't have a licensing process for private non-medical home care agencies. So you really don't know who it is that's coming in to help with, in this case, the person that was profiled, his wife at very young age, 58, has serious Alzheimer's and needs daily help, and he's not getting very good people. What's the deal?
It's so interesting because I've been doing policy since I was young. I was hired at Blue Cross many years ago, and I became a policy person. Of course, you don't really understand how policy works until you actually work in that space. And then it opens your eyes to certain things are inevitable. It is inevitable that they will have to regulate this part of the health sector. That when you have non-clinical staff coming into homes, and my sister, and I think both of you know, just passed away about 2 months ago, and she had a personal care attendant to deal with her illnesses for months. You need that person to be reliable. You need to know they're not going to steal your stuff. You need to know that someone did a background check on that person. You need to know that they're competent and qualified, that they're being trained and regularly trained to meet the care needs that you have. And that we live in a commonwealth where, manicurists and barbers and massage therapists are regulated, but not
It's unbelievable.
These folks that treat our elderly, our most fragile.
Yeah, well, you got to watch out.
It makes no sense.
You got to watch out for those manicurists. You got to watch them every second, Michael.
It's one of these things, though. You're kinder to the legislature than we are, and it's probably because you know them better and you actually have some success. We get nowhere with things we care about. But this is one of these things. As Marjorie said, 46 states have this. It's so obvious that if you can't open, as you say, a barbershop without a license, you shouldn't be able to do this. There's a proposal to regulate the employers rather than the individual employees, which sounds to me like a reasonable first step. This is just something that should be moved on quickly. These are, for the most part, your sister, my mother-in-law, all these people are totally dependent on what, I just want to say, in many cases, are some of the most wonderful giving people on the planet, but it's often a crapshoot. So they should just do the damn thing and assure that when you hire somebody, you're getting high quality for somebody you love. It's so simple to me.
Well, shout out to Representative Thomas Stanley, the person who filed the legislature who filed the bill. It creates a licensing requirement and establishes standards and oversight for the non-medical home care agencies. So I think, to your point, Jim, if we can start with the agencies themselves, and then we can, explore how do we make sure that individuals who work in these agencies are also getting the regulatory support that they need, or standards that they need. We're talking about 100,000 people work in home health and personal care aides in Massachusetts. That's a lot of people. Who are serving, and on average they're making $17 an hour. So it's not a highly paid job. My guess is the churn, as we use that policy term, people go into that job and don't stay in those jobs because it doesn't pay enough for you to really make a living on all the time. So ultimately, there's some work that needs to be done here to protect the workers, most importantly, protect the patients, and then to hold these agencies accountable to and to support those agencies in meeting the needs of our loved ones.
I just want to throw in, since I mentioned it in passing, the woman who is caring for my mother-in-law is maybe the kindest, most terrific human being I've ever met in my life. It's just unbelievable. So, Michael, there's a major anniversary that you're going to be celebrating in a couple of days, which is huge. Give us a little history and tell us what you're doing.
So, Dr. Jack Geiger, who was at Tufts as a physician in the 1950s and 60s, traveled to South Africa, and he saw a model of healthcare where it was community health. And he was so intrigued by these phenomenal physicians who were going out in communities in Africa and treating patients that he brought that model back. These clinics in communities that you don't have to travel distances. They're around the corner, that the people in the clinic may speak your language. They know you. They have your lived experience. They believe you when you come in with pain. And he launched this effort in 1965 called Community Health Centers. And on December 11th, 1965, a year after the Voting Rights Act, the Civil Rights Act, the same year as the Voting Rights Act, the same year as the passage of Medicaid and Medicare.
Yes.
In the war on poverty and the Great Society under Lyndon Johnson was born Community Health Centers. And that first one opened in Columbia Point in Dorchester, where my sisters grew up, in Columbia Point, and Senator Kennedy visited. And he was so impressed by what he saw that day at the health center that he helped to launch the movement that is now, from that very first one in Columbia Point. Now there are over 16,000 sites, 1,600 health centers across the country, and 32.5 million patients being served.
Wow.
And 1 million of them here in Massachusetts. So imagine 60 years ago, December 11th, 60 years ago, this movement was born just in our backyard here in Dorchester. We want to celebrate that. So we're going to be at the EMK Institute. Thank you to the Kennedy family and the leadership of the Kennedy Institute. We're going to be there to celebrate. We're going to have a phenomenal panel. You're going to love this, Jim and Marjorie. We got a photojournalist that we're going to do a panel with, Bill Brett, Don West, talking about their books and the photographs that they've captured. And then we move into a panel of historians talking about this movement and what we've accomplished in 60 years.
We're going to be there. Is that open to the public? Marjorie and I are both.
It is open to the public. Yeah. It is 5 to 8. You want to get there early because the conversation is going to be rich, and we got some great conversation and some great people. You have to register, so just reach out to the Mass League, and we'll get you the registration link.
Yeah, this is going to be great. Bill Brett, he's a great photographer.
What's the
website? Just search for Mass League, Massachusetts League of Community Health Centers. You'll get our website, and you can contact us to attend.
You know, really, when I was reading the history and listening to you, but both the Columbia Point thing and what was achieved in those few years with Lyndon Johnson, and you say to yourself, when you repeated the notion that Social Security and Medicare, do you not say to yourself, what was life like before? I mean, it's really.
You were dead.
Staggering.
You were dead. That's what life was like. Died early.
Political commentary. America wasn't great, and health wasn't great at that point. So I don't know when it was great, but it wasn't great up to that point. And I think ultimately, credit to Lyndon Johnson for having the vision. I want to stress this because you brought it up. None of those pieces of legislation were perfect. They took time.
Yeah, you're right.
To refine and to build on, just like the Affordable Care Act.
Congratulations to you and all of your colleagues, and we're really looking forward to this event.
Yeah, Michael, thank you very much.
Thank you. Honored to have you.
Oh, we're thrilled to be here. It's going to be great. We've been speaking with Michael Curry, CEO of the Mass League of Community Health Centers, on the board of the National NAACP. We say goodbye to you folks listening on NEPM, and thank you so much for tuning in to us. You can also tune in to the great, fabulous 413 starting at 3 this afternoon. Our show continues here in Boston, coming up after the new news on 89.7 GBH. Food policy analyst Corby Kummer here to break down the rising costs of pantry staples like coffee and pasta. I'm Marjorie Egan. He is Jim Browdy, bravely broadcasting from home, suffering through a COVID ordeal. You're listening to BPR on GBH and NEPM and streaming at youtube.com/GBH News.
It's not over yet. More smart conversation about community issues up ahead with Jim Braude and Marjorie Egan on Boston Public Radio, right after a news update from NPR. Stay with us here on GBH 89.7.
Funding for our programs comes from you.
And Bunker Hill Community College, registering for online winter session, a 3-week session starting January 5th, designed to help students catch up on classes and get ahead. bhcc.edu/winter.
Every story has its twists and turns, so let the PBS NewsHour set the record straight. Get the facts you need from America's most trusted news source. Don't miss PBS NewsHour, weeknights at 6 on GBH2.
You're listening to 89.7 WGBH HD1 Boston. Online at gbhnews.org. GBH News. What matters to you?
I'm Jim Braude, head on Hour 2 of BPR. We're starting the noon hour with Tufts food policy analyst Corby Kummer on why cutting tariffs on things like beef, coffee, and bananas may not bring their prices down. Plus, which huge corporations, courtesy of the Globe, are using taxpayer dollars in the form of SNAP benefits to increase their bottom line.
I'm Marjorie Egan, then Boston Medical Center's Dr. Katherine Gergen Barnett on why stable housing is vital for keeping people healthy. She explains what the latest CDC vaccine changes mean for people in Massachusetts as well. Plus, we'll remember English playwright and screenwriter Tom Stoppard by revisiting our 2019 interview with him at Tanglewood. That's all next. Hour number 2 of BPR 89.7 GBH.
Live from NPR News in Washington, I'm Lakshmi Singh. Some members of Congress allege that at least one of the U.S. attacks on a boat in the Caribbean Sea may have been a war crime. In recent months, military forces have destroyed 21 vessels that the Trump administration says were trafficking drugs. At least 83 people have been killed. The U.S. government has not publicly released evidence that the boats were actually carrying drugs. Meanwhile, Venezuela alleges the U.S. intends to invade the country and seize its oil reserves. John Otis is covering the story from Colombia.
U.S. forces have destroyed more than 20 alleged drug boats, killing more than 80 people. But the Washington Post reported that following one of the first strikes back in September, there were initially 2 survivors clinging to the boat wreckage. According to the Post, Defense Secretary Pete Hegseth had given an order to kill everyone aboard alleged drug boats, and that this order led to
The man accused of killing United Healthcare CEO Brian Thompson is appearing in court in New York today. NPR's Sarah Ventry reports this begins multiple days of hearings.
The 3 suppression hearings will determine whether certain pieces of evidence will be admissible during Mangione's New York State trial. The defense argues that the alleged contents of Mangione's backpack, including a journal, should be inadmissible because law enforcement did not have a search warrant at the time of his arrest. This is Mangione's first court appearance since September, and the hearings are expected to last throughout the week. His state charges include murder, criminal possession of a weapon, and criminal possession of a forged instrument. Mangione also faces federal charges, which, if convicted, could include a death sentence. That case is moving on a parallel track, though no trial date has been set yet in either case. Sarah Ventry, NPR News, New York.
The medical journal JAMA is publishing new guidelines from the World Health Organization GLP-1 therapy, such as Ozempic. Here's NPR's Gabrielle Emanuel.
Worldwide, obesity affects over 1 billion people, and that's projected to rise to 2 billion by 2030. Francesca Ciletti is with WHO and co-authored the guidelines.
We have never had guidelines on the treatment of obesity before. And it's the first guideline on GLP-1 therapies.
The guidelines say it's critical that GLP-1s are part of a broader medical plan, including physical activity and management of chronic diseases linked to obesity. They also call for equitable access to GLP-1s that prioritizes those with the highest need, as well as more research on long-term use and safety. Gabriela Emanuel, NPR News.
It's NPR.
Good afternoon. With the latest from the GBH Newsroom, I'm Henry Santoro. The Somerville-based biotech company Biomedicines is planning to start clinical trials for an AI-engineered asthma drug. The treatment, labeled GB0895, is designed to target a type of protein that causes airway inflammation. Researchers used AI to optimize the drug's development, including factors like its immune response in the body as well as its potency and half-life. Late-stage trials will examine roughly 1,600 people with severe asthma over the course of a year. If successful, this drug would only need to be injected every 6 months. And if you're going for a walk in the woods over the next couple of weeks, you may want to consider wearing orange. Shotgun deer hunting season begins today and will last until December 13th. That's every day except Sundays over the next 2 weeks. Hunting begins a half hour before sunrise and closes a half hour after sunset. Hunters are required to wear orange. Massachusetts Governor Maura Healey hosts the annual State House tree lighting ceremony later today with First Lady Joanna Lydgate and Lieutenant Governor Kim Driscoll. The event is free, it's open to the public, and takes place on the steps of the State House at 5 p.m., which is good because the sun sets at 4:12 today. 4:12. In sports, Monday Night Football, the Patriots host the Giants at Gillette, and it is Cyber Monday. My head is buffering from all the Cyber Monday emails I'm getting. In the forecast, sunny low 40s today. It is 40 degrees outside our studios right now. This is GBH News.
Support for NPR comes from NPR stations. Other contributors include Progressive Insurance with Snapshot, a personalized program that bases rates on safe driving habits, at Progressive.com. Not available in California or from all agents. This is NPR.
Welcome to hour number 2 of Boston Public Radio. Jim Braude and Marjorie Egan. We are streaming at youtube.com/GBH News. We'll be back at the Boston Public Library tomorrow. Jim is recovering from COVID. We hope he can make it tomorrow. He's coughing an awful lot today, but he says he's better. What about the cough button, Jim? You don't have a cough button at home?
I do not.
You do not?
I'm in my boudoir, as you said, Marjorie. We don't have a cough button in the
Jim
boudoir.
Is in his red boudoir, actually. It was very impressive. Boudoir, exactly.
Thank you, Julianne.
But anyway, we hope Jim is back tomorrow, but he will be on the phone if he's not actually at the library. CNN's John King is going to join us. Actor Ethan Hawke is going to Zoom in, and Boston Pops conductor Keith Lockhart is going to be with us tomorrow. Hello again, Jim.
Before I introduce our next guest, I mentioned this at the top of the show and totally forgot, and a colleague of mine, a friend of mine, actually not a colleague, just reminded me. Today is World AIDS Day, and another unimaginable disgrace for this administration. The Trump administration sent out a memo saying the U.S. government will not be commemorating World AIDS Day. Instructions for compliance follow. And in the memo, they say things like, we're not going to recognize any commemoration days, even though just recently they recognized that incredibly important week, Anti-Communism Week. But it is...
Anti-Communism Week?
Yes.
I missed that.
Yeah, we missed it. But again, first time since 88, first time this country has decided we will not recognize World AIDS Day. So there you are. And in any case, we're joined now on Zoom by Corby Kummer, Executive Director of the Food and Society Policy Program in the Aspen Institute, Senior Editor at The Atlantic, and a Senior Lecturer at the Tuss Friedman School of Nutrition, Science, and Policy. Hello, Corby Kummer.
Hello, Jim. Hello, Marjorie. And although you'll be very tired of this, what number time is this that you've had COVID?
It's funny you say, I think it's 5. But let me just be clear, because all these anti-vax people have been reaching out. I have never been to the hospital. I've never had it for this. I've never had it badly. It's not fun, but so the vaccines are working.
Corby, Jim is a social butterfly, and when you flit to as many events as he does, sooner or later, you're bound to come down with something.
Comes home to roost.
That's right. Corby, let's talk about food prices. The president announced he's going to lower some of these tariffs because lots of people are complaining about the price of things like coffee and pasta, but apparently it's not going to affect much. Why not? I don't get it. Why not?
Well, it is going to affect a lot. It has to do with what's the main source of the foods that we're worried about.
Yep.
And in the case of, for example, beef, most beef that U.S. consumes is raised in the U.S. In the case of bananas, No, not in the U.S., but the price hikes haven't been that big. You know, there was just a piece in the Globe about coffee prices and that they've really risen in Boston, and not only because of the tariffs, more than 36% since January in Boston, but it also has to do with drought. But it's just more than the rest of the country. And owners can absorb a certain amount of the tariffs, but they can't absorb that much. But a Washington Post piece picking 7 foods on which there were tariffs was saying that they're not going to be that high that immediately. What Trump administration has to worry about is rising prices across the board for food.
Let me go back to, I think, Marjorie's question.
I'm unclear.
Yeah, you were totally unclear, but
yes.
I mean that in the nicest way.
It's okay.
What a Washington Post story is suggesting is that even though he is cutting tariffs for political reasons, I'd say, but whatever the reason, on things like coffee, beef, tomatoes, bananas, the likelihood of having a price impact is minimal because, as the Washington Post story asks, when was the last time somebody who provides beef or bananas or coffee lowered prices because they're once the price is at X because of tariffs and is tolerated by the market, even if it's unpleasant, the notion that they're going to drop it because you're nodding in agreement. So that's correct.
Because
right?
that's what stuck out to me most in the story too. The idea that once they get ratcheted up, they're not going to come down.
Exactly.
Well, this is Biden used to talk about this price gouging by the food producers. So is that what this is? Price gouging again?
No, I'm sympathetic to retailers because I think that retailers have to pass on tariff rising costs across the board. You know, foodies have been completely in a swivet, as the English would say, about Italian pasta prices. So the Trump administration is going to wind up between 2 sets of tariffs, 107% rise in Italian pasta prices. So, you know, that hits us where we live because we all love pasta and we especially love Italian pasta. So that's something where it's a direct result of tariffs. What was interesting is the Washington Post story saying so far the tariffs aren't going to completely double the prices or raise them in an unaffordable way of 7 foodstuffs that they chose: bananas, tomatoes, coffee, orange juice, and beef.
By the way, let me just say...
Did you see the texter, Jim?
Yeah, do you want to read that? Because that's totally untrue. It's almost like...
If Jim Browdy would just use utensils provided at the Whole Foods bar rather than shoving fistfuls of mac and cheese straight into his mouth, he probably wouldn't get COVID so often.
I bring my own spoons, but that's okay. You know, another incredible story. We had this discussion...
This drives me nuts.
On the show about 2 or 3 years ago, Marjorie and I were railing against McDonald's, saying that essentially the taxpayers are subsidizing the profits of McDonald's because so many of their employees are on food stamps. There's this great Globe reporting, 74% of people who get SNAP benefits in Massachusetts, food stamps, work. So right away it disproves this notion that these are for these lazy, horrible people who we don't want to help. That's number one. And number two, the people we're really helping, they list the 10 companies that employ the greatest numbers of SNAP benefits in Massachusetts. There were those poor, suffering companies like Amazon, Walmart, Uber, who clearly need help from you, me, and Marjorie. What's your reaction to this?
Think about this. We financed Jeff Bezos' extravagant wedding over there in Venice with the multi-million-dollar. How much did you spend on that wedding? Millions,
I don't know,
right?
But Corby, why isn't there a proposal, or maybe there is, for whatever dollars, let's take Amazon, saves, that's how much their taxes should increase to offset what we're paying to subsidize their employees' nutrition?
I've never seen any kind of proposal ever like that the companies whose employees are disproportionately affected and have to get food stamps should actually pay taxes rather than what we always call for, which is just pay them more so that they don't have to be on SNAP. They're not going to do that. But taxing them because of the usage of SNAP, now that's an idea. But of course, the Trump administration is so respectful of big business that it would never do that.
Isn't it incredible to think about, though, that someone like Jeff Bezos, one of the richest men on earth, pays his employees so little that they qualify for food help because they can't...
How do the rich get rich? There's nothing incredible about it at all.
I guess. I mean, you'd think you'd be embarrassed, but I guess that's out the window,
speaking of
too.
embarrassed, can we go to embarrassed for a second?
Yeah.
Number 6 on this list, the 6th most number of employees at Stop and Shop. But listen to who's number 7th. Mass General Brigham is number 7 on this list.
First thing I underlined.
How can they? I mean, we haven't ever spoken to the CEO, the relatively new CEO. What might their explanation, their defense of this
I think that they were quoted in that story as saying,
I missed it.
They're on contract. It's not our fault. It's the contractors. It's only 1% of our 46,000 employees. So nothing to see here that nearly 1,000 workers for Mass General Brigham are on food stamps because it's just 1% of the workforce of 84,435. And that it connects employees experiencing financial difficulties with internal and community resources. And the spokesperson did not specify what role these workers fill at MGB, but we can guess.
Can I say, by the way, the solution for that, for those who are nodding and saying, well, that's a good argument, they're contractors. What you do if you're an employer when you sign a contract is you say, this contract mandates that nobody who works for you, Mr. or Ms. Contractor, will be paid so little that they qualify for SNAP benefits. End of discussion. And if you can't guarantee that, then you don't get the contract. I mean, really,
you're full of good ideas today, Jim.
It's a rare moment. It's the COVID.
But it says something about, obviously, the cost of living, that housing is so expensive, healthcare is so expensive, that you're in kind of these desperate straits. I mean, everything is just so expensive.
Wait, what are you talking about?
What?
Amazon is Jeff Bezos is one of the richest people in the world. He could afford to pay these people enough money so they don't get SNAP benefits.
But what I'm saying is that their wages are so small and their rent is so high and everything else is so high that they can't afford anything.
Right, and why are their wages so high? So he can get richer.
That's right. So he can have that extravagant
Before we leave
wedding.
Mass General, I have to put in a plug for a meeting that my program, Food and Society at the Aspen Institute, held in Revere, at a Mass General Health Center that's in Revere, right at a subway stop at Revere Beach. Mm-hmm. There's a teaching kitchen there. And a family practitioner named Jacob Mirsky, who's big in the American College of Lifestyle Medicine, has started this food pantry and teaching kitchen that connects a lot of patients who have diabetes or are pre-diabetic to cooking classes, shows them how to get SNAP benefits, sends them home with groceries from the food pantry, and teaches classes once or twice a week in Spanish as well as English. So, a part of Mass General is doing something that's really a national leader in teaching kitchens and opening a food pantry on site at a health center. So there are good steps at different parts of...
they do. They're brilliant. I mean, it's one of the best hospitals on the planet, and yet further reason they shouldn't be having even contract employees so poor that they need SNAP benefits. We're talking to Corby Kummer.
Okay, so this next story from the Wall Street Journal, man, was really, a wake-up call that people are worried so much about food now that they're taking home bone bags from restaurants, and then they're turning these bone bags into food, or they're putting leftover pizzas into scrambled eggs to try to, expand the meal and the protein and stuff. And Chinese takeout, they get Chinese takeout, they save the rice for days and days so they can have a rice-based dinner.
So as you're talking about that and highlighting interesting facts from the Wall Street Journal story and reporting, the headline was about thrifty Americans.
Yeah.
And you're right, you're talking about as if it emphasizes their financial need. And that might be the reason, and definitely families and parents were saying we've got to make the dollar stretch longer. But reducing food waste and taking home leftovers is a great thing to do for everybody. And it's awful to leave food on the plate. And restaurants often give portions that are way too big because bulk buying works for them. They have inexpensive food as loss leaders or just as incentives to bring in families. Of course you should bring home that food, and you should not be overeating at one meal. So It was funny how the piece itself did not place an emphasis on financial need.
Well,
Marjorie,
what?
You know me well enough to, if I could change my middle name, it would be Jim Leftover Browdy.
Yeah.
And I am not poor.
But I don't know. After a few days, I don't know how long I leave a half-empty can of tomato paste languishing in my refrigerator. I don't know.
Scrape off the mold.
I mean, scrape off the stuff on the side of the can. Maybe I'm just not as ambitious as these people. Some of this seems kind of desperate to me, but maybe
some of it is desperate. But Corby's point is right too. Both those things are correct. No?
Okay, are you bringing home bone bags, Jim, from your extravagant dinners?
I will be now that I've read that story.
Think of the broth. I think it's a fantastic thing to do.
Okay.
Yeah.
Well, that's the story about Mike Dukakis on Thanksgiving, right? He's everybody bring their turkey carcasses to his front porch, and then he turns them into turkey soup.
No, let's be fair to Mike Dukakis.
Yep.
There was a story in the Globe, I think written by Matt Visor, who is now the brilliant political reporter for the Washington Post.
Uh-huh.
He wrote about Dukakis and turkey carcasses, and then the people rose up, I believe, on their own, and close to 100 carcasses were delivered to his front step.
That's right.
In Brookline. So it was not a request by Dukakis.
No, it was not.
It was an outpouring of love for the great Michael Dukakis.
Okay. Well, I'm not going to throw in any tomato paste anymore. I'm just going to wait for an emergency. I'll have a tomato paste sandwich, I guess.
There should have been this for all the pizzas that different enemies of the Trump administration anonymously got on their doorstep that they didn't order. Because the people were saying, we know where you live. There should have been a whole leftover app just for that pizza.
Okay, so Campbell Soup executive got himself into hot water. What happened?
This is so ridiculous. First of all, I was an IT guy, nothing to do with food manufacturing. But in a meeting, he was recorded by a whistleblower as saying, Indians are ridiculous and stupid and they don't know how to think, Indian Americans who work there, and I'm not going to have any of that AI-generated 3D printed meat.
3D printed meat, yeah.
3D printed meat, and, let's say it hit a nerve when the whistleblower made this public and Campbell's was saying, we only use USDA-approved chicken, which says nothing about animal welfare or how those chickens were treated. But it was incredibly reckless and insensitive. But you notice that Campbell didn't fire this guy. It initially put him on leave, and then it became more and more public, and they became more and more subject to scandal. And so then they fired him, and it doesn't say anything about whether they rehired the whistleblower. Nothing.
Yeah, that's a good point.
Very good point. And by the way, in whatever state this happened, if people were thinking in Massachusetts, it's a two-party consent state. You can't tape somebody without their approval. In whatever state this taping happened is a one-party consent state, and you are permitted, if you're part of the conversation, to tape someone without their consent.
Well, their headquarters are in Camden, New Jersey. And their philanthropy tried to do lots and lots for food access and education in Camden, New Jersey, and it sort of didn't come to much, but they tried. In Michigan, it's legal, and it was done in Michigan because this was a remote and idiotic IT worker in Michigan.
So, Corby,
we have lots of people, by the way, who are going home with bone bags. One person got them from the Officers Club, the hanging sides of beef leftovers, and somebody else said I should just freeze my tomato paste. Thank you.
This is fantastic. This is great information you're getting.
We should do this as a talker later in the week. Corby, I was a little disappointed when you wrote a book review that was fabulous. You'll tell us about it in the New York Times. The thing that upset me is I am writing my own memoir, and it was to be titled, I'm Not Trying to Be Difficult. And then it turns out this guy stole my title. So I'm trying to get over that. Tell us about it. I love this piece by you, and I'm going to get the book because of you. Tell us about it.
Thank you. So his name is Drew Niparon, and he grew up in Stuyvesant Town, or Peter Cooper Village, I can't remember which, but a large, affordable housing, never public housing, now expensive co-op in New York City. And his or city liquor commission. And so he got a lot of free meals at fancy restaurants. So Drew grew up going to great restaurants and really acquired a taste for them. And then he went to Cornell Hotel Management School, where they didn't want to teach much about the restaurant business or much about food. What he married when he started really successful restaurants, including the Tribeca Grill and others with Robert De Niro, and Nobu, the global phenomenon with a sushi chef from Los Angeles, also in partnership with Robert De Niro. He kept a close eye on, was this good value? Menu prices, more than other restaurateurs were keeping. And he promoted women and chefs of color long before it was fashionable, or you'd be shamed if you didn't do it. So there was a tremendous amount he achieved, and he started 45 restaurants or something.
Wow.
And he had lots of ups and downs because he's very willful. He wants to run things his way or the highway. He stretched himself too thin. So there's lots of ups and downs in this memoir. But you read about one successful entrepreneur who really loved eating more than a lot of other business people. And what's very poignant is you can tell he just hasn't really kept up with a world of social media and Instagram influencers. There's so much in the book about fear and trembling when a reviewer was going to come in. And when the reviewer came in, of course, instantly recognized because the picture was up on the wall, was the review going to do it? And the very first restaurant he opened in Manhattan, Montrachet, named for a wine, a New York Times review did make the restaurant and really made his career. But those days are gone. Those days of influence by reviewers. So he's writing about a lost world. But what really registers is he's somebody who loved good eating and hospitality, and they don't always go together.
I only have 30 seconds. Why did De Niro end their relationship?
Because even if he wasn't trying to be difficult, he was difficult.
Okay.
It's not easy to overcome those issues, I understand.
I wouldn't know, actually, so I don't know what you're talking about.
Okay.
Corby, it's nice
Corby,
to see you, as
you.
always. Thanks so much.
Thank you.
We've been speaking with Corby Kummer, Executive Director of the Food and Society Policy Program at the Aspen Institute, Senior Editor at The Atlantic, and Senior Lecturer at Tufts Friedman School of Nutrition, Science, and Policy. Poor Jim, I feel bad for you.
I'm sorry. I
Coming
tried
up,
to cough
that's okay.
to the
Coming
side.
up after this quick break, Dr. Katherine Gergen Barnett of Boston Medical Center discusses the growing gap between the federal vaccine policy and scientific consensus, how Massachusetts is responding, and also some really troubling news about difficulties during pregnancy coming back to haunt you later in life. I'm Marjorie Egan. He's Jim Browdy. BPR 897 GBH, youtube.com/GBH News.
Jamaica's recovery plan following Hurricane Melissa will cost an estimated $8 billion. Now officials need to decide whether to rebuild with wood or switch to concrete.
The technology exists. The implementation is what is key, and just taking the right decision and right choices.
I'm Scott Detrow, rebuilding Jamaica for resilience on All Things Considered from NPR News.
Today at 4, here on GBH News 89.7.
Our programs are made possible thanks to you.
And American Repertory Theater with Wonder, a new musical for the whole family based on the best-selling book and beloved movie. This holiday season, Wonder celebrates the power of kindness. amrep.org. And Classic Harbor Line, offering classic yacht cruises throughout the holiday season in Boston and New York City for families, date nights, and corporate gatherings. More at classicharborline.com.
Welcome back to BPR. Marjorie Egan and Jim Browdy. We're streaming at youtube.com/GBH News. Back at the library tomorrow. Zooming in will be John King. Actor Ethan Hawke. Ethan Hawke was with us a couple years ago.
He's
it was
great.
A huge, fun interview. And Boston Pop's conductor, Keith Lockhart, as they begin their Christmas concerts, will be with us at the library in person. Joining us now in Studio 3, even though I'm not there, is Dr. Katherine Gergen Barnett, Vice Chair of Primary Care, Innovation and Transformation at Boston Medical Center, Associate Professor at Boston University Medical School, and an Aspen Institute Health Innovators Fellow. Hey there, Doctor. How are you?
I'm well. I think I'm a little better than you.
Yeah, that'd be correct.
I'm sorry you're ill.
He's ill.
Thank you. I'm doing much better.
He's got
I'm
COVID.
So glad. I know.
Like
I heard.
the 9th time.
I was listening to the show just leading up to this.
By the way, can we just get this out of the way since you're a real doctor?
Yes.
What I said before, I have had it a ton of times, at least 5, but I've never been seriously sick. I've never been in the hospital.
Yeah.
Thus demonstrating, admittedly anecdotally, that the vaccines work.
The vaccines.
Yes.
And we're grateful that you are there and that we are here and we're only seeing you through a screen.
That's right.
Very kind of you. Thank you.
And also, you probably test more than the average person when you're feeling unwell. So,
well, I just might. I'm not going to confirm or deny that. I may test a lot.
I think he has a stash.
Do you remember one of my favorite lines? It's horrible to make a joke about this when 1 million people die. One of the most incredible things in Trump's first term. Remember when he said, one of the reasons we have so many COVID cases is because we do so much testing.
Yeah.
If we did less testing, we wouldn't.
Just stop looking.
Oh,
yes.
my God. Okay, we're
I
done.
did one more thing though.
Sure.
I heard from the earlier on the top of the hour is about World AIDS Day.
Yep. Yes.
So I'll let you know I'm wearing red in honor of World AIDS Day.
That's a very pretty
and
pendant.
despite the fact that it may not be getting recognized, I want to honor all of those people who have worked so tirelessly in getting us to the place where we are today. So it is extraordinary as a provider to be able to treat people who are living with HIV, who have undetectable viral loads, to be able to give people medication who are high risk to prevent HIV, to be able to give people medication who have been exposed to HIV within 72 hours to prevent them from becoming positive. So it's just extraordinary to think what we've done in the time span of early 1980s to today. And just wanting to put a mark on that.
Medical research.
It
is a wonderful thing. It was a death sentence in the 80s
extraordinary
and 90s.
Public health and medicine working together.
Okay, you wrote a terrific piece, Commonwealth Beacon, focusing on 2 families of patients who had terrible, terrible housing problems. Tell us about this.
So I wrote it to highlight really where we are in our housing, kind of policy and the way that it impacts the residents of Massachusetts today. The 2 stories I chose to highlight, one was an older couple who have struggled with many chronic diseases. I really highlighted the male in the couple in part because he, in particular, has very, very difficult history of stroke and diabetes and high blood pressure. And they have, and he worked within housing, actually. He helped build a number of houses in Boston when he was employed. And then when he became unemployed or actually retired, within a certain number of years, no longer had adequate resources for housing, the family became homeless, and he has spent years couch surfing, and his health has declined, obviously, for all the reasons we can understand about not having regular access to medications, healthy foods, not always able to make his appointments. And then the second group of patients I decided to highlight was a family that I take care of who came to me actually initially for prenatal care for the mother, the family, and I took care of the entire family. And they were also struggling with homelessness. And we were able to find them housing because we actually have had great programs, including a program that I highlighted called Family Aid that I can't say enough good things about as an organization helping families find housing. And now we're actually kind of at a crisis again in the state in terms of not having enough housing for families. Governor Healy has done a terrific job starting to think about increasing access to housing for elderly, ill people, but not as much for families. And wanting
the
to
shelter
highlight,
law is gone.
Yeah,
it's not
exactly,
what it was.
Correct. So it is exactly that. It was a shelter law where we actually
right to shelter.
Exactly, where we had this as a very important public health cornerstone for how we take care of families, and recognizing again that it's not just about who's at higher risk and who's at lower risk, because children who are homeless have a much higher rate and risk of becoming homeless as adults. And then their rates of chronic disease go up as adults as well. So it's really thinking about, who are we helping here? And this expression of cutting off your nose to spite your face. Like, we're thinking about savings in one place by not doing more housing for families in the short term, but in the long term, this is going to be pretty disastrous for our state.
And one thing, just to interject here, I'm sorry, Jim.
No, you go right ahead.
But we've known for some time that the places with the highest rate of homelessness are the places with the most expensive rents. So this is not people with there may be mental health issues because of their situation, but we think of homeless people as people with drug problems, alcohol problems, or mental illness issues, and these are just people who can't afford the rent.
Yeah, there was actually a great Ezra Klein piece yesterday.
Yes.
I don't know if you all saw it in the New York Times that spoke just about this, which is actually incentivizing states to have people who are renters to show up to the polls, to say that if you pass, rules that actually decrease, the amount of rent that people will be paying, people will show up. And part of it is about thinking about putting more housing in. And how do we do it? We've known for years that politicians have talked about the importance of more housing, but has been pretty anemic once people come into office. But there are these great, again, turning to Europe, amazing examples of prefabricated houses, 70% of which can be brought into cities as prefabricated homes.
By the way, if I can say, you don't have to go as far as Europe. A guy who's on our show from time to time, a friend of mine, Bruce Marks, who runs NAACP, which I would argue is the single most important home ownership program in America, based in JP. Two things. One, they're doing those prefab homes around the country and say they could work here. And number two, in relationship to what you mentioned a minute ago, he requires, before you can join and participate in the housing ownership program, you must register to vote, which I think is a wonderful phenomenal thing that they do. The other thing I want to say about your piece, which is obvious to you but not obvious to enough of us, I think in this society, most of us look at every problem in isolation, whether it's, we talked about SNAP a couple of minutes ago with Corby Kummer, we're talking about housing with you. Every one of these things, obviously but I'm not sure we all know, every one of them has a direct effect on the quality of health that an individual has. And I think we who are not in your field too narrowly view each of these problems as part of an integrated whole. Yeah,
I mean, I'm in my, perspective, everything is connected all of the time, right? But it's not just about an individual's health. It's also, if we want to be thinking about, if you want to look at it as a financial perspective, right? When you're actually taking money away from housing, you're actually going to spend much more in the long term in terms of hospital bills, emergency room utilization, all of those things. So how do we start to, again, think about the things that we most need to invest in proactively that are parts of upstream healthcare, including housing?
So, Doctor, I never heard of this. I mean, a lot of people know women who've had preeclampsia when their blood pressure goes up when they're pregnant, which is very dangerous, or they get diabetes during their pregnancy. But I had no idea until I read these stories that this could be an indication of problems later in life. So, what's this story?
So, what Marjorie is talking about, and your listeners probably don't necessarily know either, which is there's huge amount of data and evidence, more every day, indicating that what you have in pregnancy is a very high indicator of risks that you have later. So, for instance, women who are diagnosed with gestational diabetes, in other words, diabetes that is detected during pregnancy, they have a 10 times greater risk of having diabetes later in life. Similarly, if you have preeclampsia, there's many other syndromes called HELP syndrome. There's lots of pregnancy diagnoses that are connected to high blood pressure. It puts you at much higher risk for heart disease and stroke later in life. And part of, what I get to do as a family medicine doctor, because I take care of people during their pregnancy, and so I take care of them after they're pregnant too. And so I know that history, but not every woman has that benefit. So part of it's a two-way street, right? So part of this is women really need to know that they should be bringing their pregnancy medical history to their appointments. That's not what happens to you during a pregnancy isn't just an open and shut door of 9 months. We need to understand, bless you.
Sorry.
It's okay.
I'm really sorry.
It's all good. It was we need to understand that you're actually, your body is telling you things earlier in pregnancy.
It's incredible,
that is
really.
a signal. I mean, the body is amazing,
Yeah.
right? But it's also about providers asking that question.
Which I think almost never happens,
Which
does
almost
it?
never
Who asks
happens.
a 50-year-old woman about her pregnancy?
How was your pregnancy?
Yeah.
Did you have high blood pressure?
Yeah.
Did you have diabetes? And then thinking proactively around, for instance, for women who have had diabetes during pregnancy, they need to be getting a yearly A1C,
Test.
that glucose test, right? The women who have had any kinds of high blood pressure, we need to make sure we're checking their cholesterol every year. We need to make sure we're getting blood pressures on them every year. We need to actually be checking kidney function on them yearly, to be thinking about what's happening to them metabolically and what's happening to their cardiovascular risk as they're aging.
Wow. What do kidneys have to do with high blood pressure?
Oh, such a great question,
I don't know.
Marjorie.
I'm not...
So kidneys are, the vessels that go into your kidneys are incredibly sensitive to blood pressure.
Oh.
So when you have high blood pressure, it can very easily mess in these, unofficial term, mess with your kidneys. So one of the things that we always have to be doing is for people with hypertension, you get a yearly kidney check. Also, the blood pressure pills that people get put on can also affect kidneys. So that's even more so. But people who have chronic kidney disease, they almost always have a history of uncontrolled blood pressure and or diabetes, which also affects the kidneys.
Wow.
You got a little mini med school here.
I got a little mini med school. Well, I just think it's something, you've got kids, I've got kids.
It's key.
Nobody
It's
ever told me
totally-
this, or I don't think my daughter who just had my grandchildren.
Yeah, I was actually just thinking, I want to make sure that we have in the curriculum for medical students and interns when I was reading some of these studies about how rarely it's asked about.
Mr. COVID, would you like to ask the next question?
I'm too busy sneezing. I'm really sorry. Really sorry.
Okay, you're good.
So I do want to ask. I want to talk about the FDA has come out with a finding, and I use the term loosely, that they have allegedly have proof that the COVID vaccine, one of the mRNAs, killed 10 children. Is there any backup evidence to suggest that they're telling the truth, Doctor?
So the way that they gathered their data is they went to a website, which anybody can contribute to this website. So it was, patients, advocates, anti-vaccine folks, and looked to see what had happened or what was being reported for any sort of adverse outcomes for children who had gotten the COVID-19 vaccine. So that was the way the data was gotten. So I will also say there was no past medical history given of any of these children. There was no information about what the actual COVID-19 vaccine was. Was it Pfizer? Was it Moderna? What was it? We have no age on these children. So So it was very, again, this data was cherry picked. I will say we actually have very good evidence from, what we call meta-analysis studies. So you look at many different studies and then you conclude what those studies say. In 2023, we looked at JAMA came out with a study from 17 different studies looking at 10 million children, ages 5 to 10, both of whom have either gotten Pfizer or Moderna, and we saw decreased hospitalization, decreased risk of getting ill. And we also know a 2024 Nature study came out showing no adverse effects, major adverse effects. I will say we do know that there has been definitely evidence for especially teenage boys having an increased risk of what's called myocarditis, inflammation of the outside of the heart, which is usually mild and resolves. So look, it is absolutely not without risk, but the FDA pulling out these 10 kind of reports and saying, the vaccine caused these deaths is poor science.
And also, isn't it obvious that those poor science, I think, is sort of a redundancy when you're talking about anything an RFK Jr. runs, but this is going to cause more sickness or death because people who are nervous, which I respect to begin with, I mean, I don't agree with, but I understand anxiety about a lot of things, are going to say, hey, if they're killing kids, then it's probably better that my kid not take the vaccine. So it's just so gross.
Yeah, it is definitely fear inducing. I totally agree with you. And then I will also note for our listeners that this is an important week for the CDC. So the Advisory Committee for Vaccine meets this Thursday and Friday, and they will come out with their recommendations for the childhood vaccine schedule. Again, we've talked about this in a prior show. Massachusetts is one of the states that says we're going to follow our own evidence. We're going to follow the Department of Public Health, the American Academy of Pediatrics, American Academy of Family Practice, et cetera, to create our own guidelines. And so we're really sticking with the guidelines that have been made and following the science that comes out.
Didn't they just do that? Didn't we just do this with hepatitis B in infants? Yeah.
Exactly. So just very recently, Governor Healy and Dr. Goldstein, who runs the Department of Public Health, came out and confirmed that we will continue to give hepatitis B to newborns. And can I spend a moment doing a public health announcement about hepatitis B? Because I actually think that this is broadly misunderstood too. So hepatitis B is a virus, as your listeners know, that affects the liver, and it can very easily cause what's called chronic hepatitis B, which has all kinds of health consequences, most specifically liver cancer. So why do we test and why do we give newborns the vaccine? Not because we think they're out there, getting some sort of blood products off the street, right? We know that kids who are born to mothers who have active hepatitis B are, at high risk of getting hepatitis B. But we also know that caregivers who have hepatitis B are at risk of transferring it to the baby. It could be through little cut. So we call that a horizontal transmission. We call it coming through the mother, a vertical transmission to the infant. But the infants are at high risk of getting hepatitis B from everybody they come into contact with. So if a baby is exposed to hepatitis B, their risk of getting chronic hepatitis B is about 90%.
Wow.
Oh.
And of those, 25% will die from hepatitis B complications.
Oh, my goodness.
So this is not just a nice but, and not necessary vaccine. It's critical.
What's the shot you have to get when somebody has a newborn? You're going to go visit the newborn in the hospital. Is that the hepatitis B or something else?
So if you are going to visit a newborn, you're probably thinking about the Tdap, which prevents you from getting whooping cough.
Yes.
So that's probably what you're thinking about.
Yeah, they demand that now.
This we give the first hepatitis B shot to kids in the first 24 hours of life. And some places are saying, well, why do you have to do it so soon? Most places you can wait a few months. But the fact is we also know that not all babies come in right away, right? And so we need to really be thinking about the high risk just postpartum for these children.
So, doctor, where do you tell patients, other than speaking with you or other doctors they have whom they respect, where do you tell them to get their best information about vaccines and when they should be taken?
American Academy of Pediatrics, I think, is has some of the best information. I obviously, as a family medicine doctor, I also turn to AAFP that has terrific guidelines, and we have really, really clear documentation of what age people should be getting what vaccines.
I'm not going to put Dr. Katherine Gergen Barnett in the spot because she's too classy for this. So I'll ask Jim Browning. Isn't it incredible? Bill Clinton was brought down, impeached over a sex scandal. RFK Jr., has been, raided women for years before his wife hung herself in the back of the house, is involved in this other sex scandal now with Olivia Nuzzi writing these really incredible pieces of poetry.
Can't wait to hear the connection.
To her about, that this doesn't seem, no problem. He's telling everybody what kind of, that his credibility and his stature as running HHS seems not to be impacted at all. No problem. I mean, did you read these poems? It's a little weird if you ask me. I
did read the poems.
And plus his wife. I mean, I can't believe she's standing by. As people used to say, why doesn't Hillary put Bill's bags on the front lawn? Well, why doesn't she put RFK's bags on the front lawn?
Did you see Cheryl Hines being interviewed on The View a couple of weeks ago?
Yeah.
I would say because she agrees with him. That's why she hasn't put his bags on the lawn.
I don't think she agrees with him about carrying on with Olivia Nuzzi.
Oh, no, that part. No.
Yeah.
That's not really our business, I would say. Well, I'm more focused on his health
definitely not
advice.
my business.
It may not be your business.
I did read all the poems.
But
I must admit,
then you could say that Monica Lewinsky wasn't anybody's business either, and Bill Clinton got impeached over it. I would say it was
totally his business. That power differential. Yeah. We gotta go.
Okay.
We gotta go.
I think there's
I'm
a problem.
sure the doctor is really glad she's part of this conversation. Read the poems and get back to us.
All right, get better. Take care.
I appreciate it. Thanks.
Thank you very much, Dr. Katherine Gergen Barnett, Vice Chair, Primary Care Innovation and Transformation at Boston Medical Center, Associate Professor at Boston University Medical School, Aspen Institute of Health Innovators Fellow. Coming up after this break, the great playwright Tom Stoppard has died at 88 years old. We'll bring you our brief and delightful conversation with the late Sir Stoppard, recorded at Tanglewood in 2019. He's Jim Browdy. I'm Marjorie Egan. This is BPR on 89.7 GBH, streaming at youtube.com/GBH News.
What happens when your child's school is falling apart, but the funding just isn't there to fix it? In Massachusetts, suburban schools get the most state support, so struggling urban districts are forced to find their own ways to improve their aging classrooms.
Nothing more important than school buildings. That's where our kids are. So it's very important that we have a coherent and equitable funding structure to support that work.
I'm Trajan Warren. That story later today on GBH's All Things Considered.
Support for our programs comes from you.
And the Art Complex Museum in Duxbury, featuring Traces, a new exhibit by Maine artist Kitty Wales, plus works by the Boston printmakers and a special exhibit of miniatures from the museum's collection. More at artcomplex.org.
And UMass Lowell, ranked #1 best value public university in Massachusetts by the Wall Street Journal and U.S. News and World Report. Learn more at uml.edu/rankings.
Welcome back to BPR. Marjorie Egan, Jim Browdy, streaming youtube.com/GBH News. We're at the library tomorrow. Ethan Hawke, actor, writer, whole bunch of great things, is going to zoom in, as is CNN's John King. Keith Lockhart from the Boston Pops will be there in person. Tom Stoppard, famed playwright, knighted by Queen Elizabeth, died at 88 years old. Stoppard won tons of awards, the Laurence Olivier Award, 5 Tonys for Best Play, an Oscar for The Great Shakespeare in Love. His works, including Travesties, The Real Thing, The Invention of Love, were known for incredible language, sharp wit, intellectual curiosity. For the next couple of minutes, we're going to share with you a conversation Marjorie and I had with him on the grounds of Tanglewood back in 2019. I have to be honest, we were a little intimidated by the prospect, but he was nothing short of fabulous. We spoke to him about the premiere of Penelope, his reimagination of the story of Penelope, the wife of Odysseus, in the ancient Greek classic, The Odyssey by Homer. Here is Tom Stoppard.
So do we address you as Sir Tom? Is that the appropriate?
Does Lord Stoppard work for you?
Actually, that was my next option.
Okay.
So yes, it does. Very well.
Either that or Tom.
That's fine.
Tom would be best.
I think that's wonderful. So tell us how this project all came about. Tell us the genesis, how it began.
That goes back longer than you might think, because I've known Andrei Previn, who composed the music for this piece, of course. I've known him many years. We met in the early 70s, and we did one thing together in around about 1977 or 8. Every Good Boy Deserves Favor. And then we worked together where the play I was involved in needed a couple of songs. But for the last, I would say, 10 years of his life, he would say to me occasionally, could you try and write something for Renee to sing? And, I'll compose the music and it'll be the three of us. And I kept saying, I don't know how to write for singing. But the other thing I don't know is should I look at you or
either of us?
What if we go like this and you can look at us both?
I'll manage.
Okay, we figured you might.
I said, I genuinely don't know what it means to write for a singer, and I still don't. And in the end, he said, look, just do it as if it was a long speech in a play, and let me worry about how to make it sing. And so I did that. It's a sort of rhythmic kind of monologue. And I heard the music for Penelope for the first time when we had our first rehearsal. So it was a really exciting couple of hours to have a rehearsal.
So why Penelope? Lots of people know the story of the Odyssey, Odysseus' wife, Penelope. So why Penelope?
We couldn't think of anything. I kept saying, all right, I'll have a go. What should it be about? And he said, anything you like. And finally, I'm not quite sure where the thought of Penelope came from, but in the past, I've had a reason to work with Homer's Odyssey, and so I was aware that Odysseus' wife was famed for her loyalty and
20 years was it she was waiting?
Yes.
That's a long time to wait for your husband to come home.
And she, in my mind, was in a state of some resentment that her reputation came down to us as this, as it were, homely, faithful, loyal wife, knitting and weaving and patiently waiting for her man to get back from the war.
You have obviously experienced scores and scores of openings. At this stage of your career, do you feel anxiety the night before a premiere?
Not as I used to, actually. And with a concert recital, I was about to say, not so many things can go wrong, but that could be the opposite of the truth, because I never think of the music going wrong.
Yeah.
But maybe the Emerson Quartet have a different view of that, and they certainly have to rehearse very hard.
Why do you feel less anxiety now than, as you said, you used to? Why?
Because he's got 1 million awards and he's been over and over again one of the great players.
No, it still seems really important that everything should go right on the night.
That's true.
But you get older, you get more kind of fatalistic or something, and So I'm still a bit worried on the very first. It's not the first night, it's the first audience, because that's when you find out the best and the worst.
Is this your first time at Tanglewood?
Yes.
How do you feel about What's your reaction? And Ozawa Hall, where we hear beautiful music coming to us in the background, this beautiful venue with this open back that's just, I think, so enchanting. What do you think of this place?
I'm trying to think of something which isn't a cliche word, but you come here and frankly, it is amazing, as everybody probably says. It's amazing.
It is amazing.
It's utterly lovely.
Before you go, you have your world premiere tomorrow. Boris Johnson had his world premiere at 10 Downing today. What's your reaction to his ascension?
It's different from coming to Tanglewood, to be honest. We shall wait and see. It's not as though all the alternatives are deeply attractive. It's a very strange situation in England. I and most of my friends tend to say, if there was an election now, who do we vote for? Yeah. I don't think that's true here, but it's true in Britain.
Lord Stoppard, it was a joy. Thank you so much for your time.
Oh, that went very quickly. Thank you.
It did, indeed.
That was Tom Stoppard speaking with us back in 2019 at Tanglewood. He has just died. He was 88 years old. I'm Jim Browdy. He's Jim Browdy. I'm Marjorie Egan. This is BPR 89.7 GBH. We're going to talk about the Afghanistan crisis after the noon news, 1 o'clock news.
Support independent local journalism. Gain a possible tax advantage and clear out your garage all in one when you donate your old vehicle to GBH this holiday season. Learn more at gbh.org/vehicle donation.
Support for GBH comes from you.
Is December 4th through 24th. The festive cheer continues with Elf in Concert, a Charlie Brown Christmas Live, and New Year's Eve with Seth MacFarlane. More at bostonpops.org. And Heights Crossing, an assisted living and memory support community offering residents experiences aimed at promoting independence, inspiring curiosity, and encouraging connection with others. More at heightscrossing.com.
You're listening to 89.7 WGBH HD1 Boston. Online at gbhnews.org. GBH News.
I'm Jim Browdy, head on Hour 3 of BPR. After an Afghan national was charged in the shooting of 2 National Guard members in D.C. last week, one of whom has died, the Trump administration is imposing new restrictions on all refugees from Afghanistan. We'll check in with Fariba, an Afghan refugee with U.S. citizenship, about what that means for her community, including those who fought side by side with Americans in our longest war. And we'll talk with Alexandra Weber of the International Institute of New England about the impact on refugee communities.
I'm Marjorie Egan. Then we'll end the show on a lighter note. Since Jim, a big foodie, is under the weather and broadcasting today from his boudoir, plus we've learned that the president likes to have dinner in bed, we're opening the phone and text lines to talk to you about eating in bed. Do you find yourself making a bowl of food and retreating to the comfort of your duvet? Or do you hate the idea of getting crumbs between the sheets? Weighing next, BPR 89.7 GBH.
Live from NPR News, I'm Lakshmi Singh. The Trump administration is re-examining its vetting process of Afghan nationals after last week's attack in Washington, D.C. that killed 1 National Guard member and seriously wounded another. The man accused of the shooting had resettled in the United States in recent years as part of a program for Afghan nationals who worked with U.S. forces in Afghanistan. NPR's Jimena Bustillo reports the vetting process can take years before someone is approved to enter the U.S.
Now the administration is reconsidering those already here. I obtained a memo issued by the Director of U.S. Citizenship and Immigration Services late last month. That memo calls for reviewing all refugees admitted into the country under the Biden administration, essentially reopening their cases. They may need to be re-interviewed and some may lose their status. The memo says the agency should, quote, only admit refugees that can fully and appropriately assimilate. Immigration advocates have called the recent changes on refugee reviews, visa, and green card applications deeply destabilizing to families already in the U.S.
NPR's Jimena Bustillo reporting. Results from Sunday's presidential election in Honduras show two opposition candidates in the lead. NPR's Ada Peralta reports President Trump endorsed one of the conservative candidates.
Two opposition candidates, Tito Asfura, the right-wing candidate, and Salvador Nasrallah, the centrist, are leading the race according to preliminary results. President Trump jumped right in the middle of Honduran politics last week, saying if anyone other than conservative candidate Asfura won the elections, the U.S. would rethink its aid contributions. This follows a similar approach earlier this year as he weighed in on Argentina's midterm elections. Trump has had a tense relationship with Honduras's leftist president Xiomara Castro, who has allied herself with Venezuela and Cuba. Early results show Hondurans are choosing a new way forward, with Castro's party in a distant third place. Ada Peralta, NPR News, Mexico City.
Scientists say the hole in the ozone layer is the fifth smallest since 1992. NPR's Lauren Summer with details.
High in the atmosphere, there's a layer of ozone gas that acts like sunscreen for the Earth. It helps block harmful UV radiation from the sun. But in the 1980s, scientists discovered a hole in the ozone layer over Antarctica. It was caused by chemicals produced for refrigerators and air conditioners, which break down ozone once they're released. Countries came together in 1992 to phase out the use of those chemicals. Scientists at NASA and NOAA say the improving ozone hole shows those policies are working, and they expect the hole in the ozone layer to be mostly repaired by mid-century. Lauren Summer, NPR News.
The Dow Jones Industrial Average is down more than 200 points. This is NPR News.
Good afternoon. With the latest from the GBH Newsroom, I'm Henry Santoro. New Hampshire tourism officials are predicting 3 million people will hit the slopes and Nordic ski trails this winter. Early snowfall at higher elevations has also helped the season kick off with a strong start. Melody Nestor, Assistant Director of Ski New Hampshire with Tracks Conditions, said the challenge is convincing skiers that it's already winter up there.
Because certainly a lot of people who ski our mountains from south of the mountains, and it's not snowy in their backyard, so they assume there's no snow.
Oh, there's snow. And it's on the way. Several of the largest ski areas, including Bretton Woods, Cannon Mountain, and Loon Mountain, are currently open with lifts running. Massachusetts officials have filed an environmental impact document in another step towards replacing the Bourne and Sagamore bridges, set to cost at least $4.5 billion. Our colleagues at CAI report the statement as a public comment period that will last through January 5th. In sports, Monday Night Football, the Gillette Stadium is all spiffed up, ready for Monday night. The Patriots hosting the Giants at Gillette, and it is Cyber Monday today. Click, 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 spend, spend, spend. In the forecast this Cyber Monday, sunny and low 40s today, clouding up overnight tonight, low 27. And then a wintry mix tomorrow, depending on where you are. You may see several inches of snow, you may see snow mixed with rain, and you may see just rain. Mostly sunny and upper 30s on Wednesday, 40 degrees in Boston right now. This is GBH News.
Support for NPR comes from NPR stations. Other contributors include BetterHelp, committed to helping clients with issues ranging from relationship challenges and goal setting to grief and depression. Learn more at betterhelp.com/public. This is NPR.
Welcome to hour number 3 of Boston Public Radio. Jim Brady and Marjorie Egan. We are streaming at youtube.com/GBH News. We will be at the Boston Public Library tomorrow. We hope Jim is well enough to join us. He's home and is broadcasting from home because he's got COVID. Keith Lockhart from the Boston Pops is going to join us, and actor Ethan Hawke will Zoom in, and much more. Hello again, Jim.
Hello again. Marjorie. Last week, as you know, an attacker killed a National Guardsman in Washington, D.C., Sarah Beckstrom, and critically injured another. The accused shooter is an Afghan national who had served with the United States forces for a decade in Afghanistan, who had come to the U.S. after Joe Biden withdrew troops in 2021. Granted asylum, by the way, during the Trump administration, this Trump administration. Now Donald Trump is targeting all Afghan refugees in the country, calling for stricter rules. totally holding Afghan immigration, conducting a sweeping review of green cards in general, and pausing all asylum hearings for those fearful of violence or persecution in their home country. Joining us now on Zoom with the camera off is Fariba, an Afghan refugee herself who worked with USAID and has since obtained naturalized U.S. citizenship last year. Also with us in Studio 3 is Zan Weber of the International Institute of New England, the largest refugee resettlement nonprofit in the region. Welcome to both of you. Thanks for joining us.
Thanks so much for having us.
Well, let's start with, and thank you both for joining us. But I'm going to start with you, Zan, because it seems as though now all people who are from Afghanistan are, and many other refugees from other countries are now paying a price for the deeds of this one man.
Thank you so much for starting with that. I think we absolutely agree. And of course, our first concern when we heard the news last week was for the National Guard's members. But our immediate second concern was that the Trump administration was going to use the attacks to weaponize and condemn all Afghans. And that's exactly what's happening.
When you say that, just so that I'm sure that what I said is true, he's holding all immigration processing for Afghans in total and saying that there should be some review of whatever status has been granted to those people from Afghanistan in the past. Is that correct?
That's correct. And it's a continuation, I think, of what's been happening. One of his first executive actions was to pause the refugee resettlement program, which has not really been introduced in real way. This next step, I think, is to, last week or the week before, the administration came out to say they were going to start re-interviewing anyone who is seeking permanent residency after refugee status. And now we're at the point of them considering re-interviewing refugees themselves who have already been granted asylum in the U.S.
Fariba, can you explain to people, I think most of us have heard the term special immigration visa, which applies to some people from Afghanistan who helped American troops during our longest war effort there. That's correct, right?
Yes, correct. Those who work with U.S. government back in Afghanistan will be only eligible to receive the special immigration visas status.
And what this is almost too obvious to ask, but I'm going to do it anyway. When the Taliban learned in Afghanistan has helped U.S. troops, if they're not able to leave the country and or come to the United States, what's likely to happen to them?
Will definitely be life in a danger. Life will be in a danger, definitely will find and kill him. Because when I was working in Afghanistan as a civil rights activist and helping Afghan women to get the education, providing internship, advocate for domestic violence situations, I was being attacked twice. And every 6 months, I was hiding my location, changing my home, so they couldn't find my exact location. They killed many of my friends. The day which 2019 was the luckiest year which I got my visa. And when I come to the United States, it felt like the real life. I felt like I got a reborn. I truly understand what's the real meaning of life, joy, happiness, and freedom, which I'm really grateful for this opportunity. However, I started everything from zero, but still I'm happy for the opportunity that I got. And still there are many people struggling with the same situation, worse than where I was.
And when you came to this country, you had interactions with the International Institute of New England. Can you say what they were able to do for you?
Yeah, sure. International Institute of New England changed my entire life. However, I was educated. I knew the language, but I don't know where to start from the zero. They helped me get a job. They introduced universities, college to me where I get my education. And currently I'm doing my master's degree. They provide resettlement, they show around, they provide housing, all the support that a refugee is getting. And I'm so grateful for the opportunity. And I'm happy that currently I'm working in that with them.
Are you safe now because you're a naturalized citizen or not? Do you know, Fariba?
Well, I'm happy I'm naturalized, but I don't feel like I am kind of safe. Looking to current administration and situations, it'd be possible to take away that naturalization anytime because it's uncertain, fear, and I'm carrying all my documents all the time with me. If I'm in the car or with my bags, I have some sort of documents with me to make sure if I have been stopped, so I can show I'm citizen of this country. I was not expecting the situation's gonna happen because I served this last 5 year and turning 6 year. I honestly serve for this country. I love this country and I work my best to give back what they give it to me for the opportunity.
By the way, and it bears noting, which I guess is obvious to listeners, that Fariba asked us not to show her image, which I think as a citizen is really, it's shameful that our country puts someone like that in this position. I also want to say one more thing. We've spoken to veterans on the air, people like Seth Moulton, who had translators who he was concerned about bringing to this country. And he makes the point, not only is it unsafe for the person from Afghanistan who is courageous enough to risk their life to help try to bring freedom and democracy to their country, but why is anybody in any war in the future, any conflict, ever going to trust the United States if they know that we're going to renege on a commitment to help them if they help us? So, I mean, that's a whole other issue.
Yeah, I was going to ask, and we're talking with Zan Weber from the International Institute of New England, as well as Fariba, who came here from Afghanistan after working with USAID, which is no longer actually functioning. But Zan, how much do you think that it matters that the military is speaking out about this, that this may not actually happen, or do you think this is just a done deal with the Afghanis?
I think it's incredibly important that our military is speaking out in support. I think refugees come here to survive, but through coming here, they help us survive. And I think the military knows the implications for survival more than anybody else. I think that when Afghans were first evacuated, there was 76,000 people who over the last few years came to the U.S., and the vast majority of those people are like Fariba. They're grateful. They've gotten a second chance. They're here to work hard and live in peace. They're giving back. And then to, just have one person who did a despicable act to use that person to represent an entire community would be the same as if one native-born person, did something and we decided they were going to represent 76,000 native-born people. So, I do think that we don't know a lot about the shooter and his motivations, but it does feel like this may be a mental health issue, and I'd love to see us focus on a mental health issue and maybe something more like a lone wolf situation, which we constantly talk about when it comes to other attacks.
Fariba, you mentioned before that friends of yours were killed, and I assume you still have friends in Afghanistan or maybe even family members in Afghanistan, and some of these other refugees that came here. If these people were sent back after having gotten here because they helped the U.S. military, what do you think is going to happen?
I'm sure the Taliban won't leave them peacefully, or even there a chance of do whatever they want. Maybe kill them, maybe not returning. Do a lot of domestic violence. There are a lot of things are going currently. And as I heard from my friends, they even can't go out of the home for a month and months without a man. It's like a home, like a jail. So sending out these people back in the home country will no one guarantee their life. They will leave alive or not, what's gonna happen with them. It's something uncertain, which I can't say. I can't even imagine.
Fariba, it's not. Is it beyond the most extreme thing that Marjorie just mentioned to you about sending people who went through the proper process and are here legally back, which I just can't imagine, but I can't imagine this other stuff. Also, if someone from Afghanistan was in the process of applying for a visa, once Trump issued his order the other day, he basically says, rip up the application documents. It's as if nothing, as if they had never applied for anything. What do you tell your fellow country people? What do you tell them when they played by the rules? They did nothing wrong. They were going through the legal process, and all of a sudden, their legs are cut out from under them.
This last Thanksgiving, I visited some family and friends in the community. We had the same discussion about what's going to happen to these people who are waiting years and years for their visa to get it. The government that respond another layer of a pain to the people, like the decisions of holding visas for SIV holders who wait decades to get here. The life is on limbo. Like many 1,000 Afghan families are in limbo. There are many people in my friends and families members are in Pakistan, where they are even not safe in Pakistan. They cannot come out of their home, and they cannot even return back to Afghanistan. They don't have money to go back. Some of them threaten got money because of their life. They even accepting to stay in Pakistan, hide in a very little village where they, at the 3-time food, they can only eat one, not to return and back to go to Afghanistan of current situations. I don't know what's going to happen, what will be happening, but it's not a happy moment for everybody.
Fariba, I think back to a time that it was very hopeful before things really went south in Afghanistan in terms of the United States efforts there. When we talked to, and Jim, you would know this, when we had them in the studio that did the schools for girls, and how they would sit down with the fathers of these girls who were at first very opposed to their going to school, and then they changed their mind. You would see these sometimes like 7-year-old girls or 11-year-old girls so excited about learning. And I think you just mentioned now girls and women not being able to leave their homes without a man. So things have gone back to this no more schools, no more education kind of thing. And that's what you were working on.
Exactly. No more educations, no more school, no more working. No, even a simple shopping is not allowed. If you go to with your own, someone accompany you, a man accompany you, but you will dress according whatever they want, but they are still beating women on the street for no reason, because you're not dressed properly, you're not hit up properly. They're finding a way to treat women, to make the lives hell for the woman specifically, which I feel very bad and sorry, because I was a woman advocate for now. Every night, even I can imagine what those girls and women are going through nowadays.
Let me just say, Marjorie mentioned the woman's name was Razia John.
Yes, Razia John.
And a colleague of ours, Beth Murphy, did a brilliant movie about a decade ago called What Tomorrow Brings. And it is a beautiful and painful story about the effort of this woman who lived here, who went back at great risk and believed it was as important as our Fariba and others do, that women have opportunity in Afghanistan. Zen, can we get back to the broader thing that doesn't just affect people from Afghanistan applying for asylum? Could you explain to people what asylum applications are intended to address, and what's the consequence of Trump's halting of any asylum hearings going forward, at least for the time being?
Sure. And I'll first say that Beth Murphy used to be on our board.
I didn't
we
know
love
that.
her.
She is brilliant filmmaker.
Incredible.
She's
an
great.
Amazing representative. So asylum is it's the same actual status as refugee status. Asylum you apply for in the U.S. and refugee status you're granted outside of the U.S. But they're both based on a well-founded fear of persecution in your home country. For most refugees, they're outside of their home country. They can't go back to their home country, which basically means that, if they're not received in or allowed to stay in a receiving community, that they're stateless. And so when the U.S. grants admission to refugees, we're basically giving them an opportunity to become a citizen of another country. And it's the same as people who are applying for asylum in the U.S. It's intended to help people both stay here temporarily while their asylum is adjudicated, and if they're granted asylum, then be put on a pathway to citizenship and to be able to stay here forever, and to also be able to apply for family members to join them. Many Afghan war allies have family members who are still trapped in Afghanistan, and they're hoping to reunite with.
So what happens when this process is at least hopefully only temporarily suspended by Trump? What happens to these people who had applied for asylum?
It's such a great question. I think there's so many people now whose status has changed by this administration, and already there's, I think, 1 million people waiting in the asylum process for their asylum to be adjudicated. So I think for many people, your wait or your time waiting does not come with work authorization. So you're then not really able to support yourself. So I think across the board, there's hundreds of thousands of people who have had their status revoked, interrupted, they're threatening to reinterrogate, to somehow decide whether they're continuously safe. So I think for most people, it's both this sort of more of the same in terms of being in a limbo, but I think particularly for refugees and asylees, they thought it was over after all this time, all this tragedy, sometimes sacrificing for others like the American military. And now, what are we giving them back?
Well, can I just add one? I want to add one fact from the beginning of this discussion that I mentioned, but I want people who just tuned in. Well, Donald Trump is doing what Donald Trump always does, which is not only overreact, but anything bad that happens in this country is Joe Biden's fault. This alleged killer was granted asylum in April during the presidency of Donald Trump, for whatever that's worth. So
I think that it's ridiculous to think you have 76,000 people coming from Afghanistan. Yeah. Just like if you have 76,000 of anything, whether they're Americans that have been here their whole lives, or they're people that came in from Afghanistan, or they came from Timbuktu, there's bound to be people that have mental health issues. And the idea that we're going to paint the entire group of people because of one man, I mean...
Right, it's so irrational, and we really don't do this, in any other circumstance. So again, I think this is just the weaponization of what's happened, really putting at risk, I think, an asylum process that was already in part broken, but not because it wasn't highly vetted enough, not because it wasn't, interrogating people well enough. I think because we don't have enough asylum officers to help adjudicate people.
Well, also, they don't look like Donald Trump. I mean, that's the bottom line. If you look like Donald Trump and you're from South Africa, then you're this victims
it tends
of
to
genocide.
Happen to people of who are not straight white men.
Hey, Zan, you've been represented, you and your colleagues have been here a number of times, but I fear that people don't know what the International Institute of New England does. Explain to people and give us a website.
Yes. So the International Institute of New England is one of New England's oldest resettlement organizations. We've been around for 106 years. That's the entire 20th century almost. And we provide really support so that refugees and other immigrants can realize their opportunities in the U.S. And that's really through all types of case management supports, education, English language, employment, and legal services. And we have 3 sites across Massachusetts and New Hampshire. We serve thousands of people a year. And our whole goal is to help them in the beginning get enough support to immediately start to give back, which they do. Our website is www.iine.org.
And you lost a lot of federal money. How are you surviving that?
So, that's a great point. Not only has the federal government disrupted our immigration processes that were not great to begin with, but it's also pulled back a lot of funding and support. And you could argue that, the more support that we offer people from the beginning, the more opportunity they're going to have to succeed, like someone like Fariba. It has been incredibly challenging to have lost federal support. Luckily, we do have community support across Massachusetts and New Hampshire, which we're relying on more than ever. But there, as most people will tell you, there's nothing that can replace federal support.
Fariba, what can people do that are concerned about this situation? People that are listening to us now.
Support the community. It then says one person action should not blame the entire nation.
Yeah.
We are Afghans. We are rich in hospitality. We always love people and support people. We should support this community. And we cannot judge the entire nation by one person's actions. Every nation have a bad and good. Doing one person bad things does not mean we are Afghans bad. We are nice people. We love, and all the community is really grateful for the opportunity of being here. There are children, there are kids who have a hope for a future. So help them to grow, help them to study, help them to get the education, the right, and the happiness that they deserve to be in this country.
Thank you for the work you're both doing. I'm sorry, Fariba. Continue. I'm sorry.
But being here, they lost the loved one, they lost family members in supporting the U.S. government back home. They lost everything that they have. It's not easy as a refugee. You start the life from zero and a lot of stress, a lot of mental health issue I have been through. So I'm requesting everyone in the community to support them. Thank you. Thank you for having us.
Thank you very much. And I hope everything works out for you and your family, Fariba. Thank you for joining us.
Thank you.
And thank you as well to Alexandra Weber of the International Institute of New England, IINE.org for more information. That's IINE. Thank you very much, too, for coming in.
Thank you both so much.
Coming up after a quick break, it is cold season. Jim has COVID, as you can hear, because he's coughing constantly. He's had, I think this is his 67th time he's had COVID.
It's fifth.
Okay, fifth time. Okay. We just learned, though, that Donald Trump prefers dining in bed. Jim's been broadcasting from a bedroom, and he's been eating in bed during the entire show. So we're going to open the lines to get your thoughts on eating in bed. Beyond the occasional breakfast in bed for Mother's or Father's Day, you're guilty of squirreling away your meals for a solitary horizontal snack. Lightening things up a little bit here. I'm Marjorie Egan. He's Jim Browder. You're listening to BPR 89.7 and streaming at youtube.com/GBH News.
Jamaica's recovery plan following Hurricane Melissa will cost an estimated $8 billion. Now officials need to decide whether to rebuild with wood or switch to concrete.
The technology exists. The implementation is what is key, and of taking the right decision and right choices.
I'm Scott Detrow, rebuilding Jamaica for resilience on All Things Considered from NPR News.
Today at 4, here on GBH News 89.7.
Our programs are made possible thanks to you.
And Commonwealth Shakespeare Company. From the heart of Boston to the heart of your holidays, Charles Dickens' A Christmas Carol returns to the Emerson Cutler Majestic Theater December 6th through 23rd. Ticket information at comshakes.org/Scrooge25.
And UMass Lowell, ranked #1 best value public university in Massachusetts by the Wall Street Journal and U.S. News and World Report. Learn more at uml.edu/rankings.
Welcome back to BPR. Marjorie Egan, Jim Browdy, streaming at youtube.com/GBH News. We're back at the library tomorrow. CNN's John King will zoom in. Brilliant actor Ethan Hawke will zoom in, and Boston Pop's conductor Keith Lockhart will actually show up in person to talk about the Christmas Pops. So we're ending the show today with the national feast that is Thanksgiving in the rearview mirror, with new revelations about Trump's how should I put this, rather odd dining habits. You know, the man who famously held a fast food banquet for the Clemson Tigers in celebration of their NCAA football championship during his first term. Now, the latest revelation about Trump's eating habits comes from biographer Michael Wolff, who got to spend time with Trump in the White House.
Yeah.
The leader of the so-called free world likes to eat dinner in bed. And we figured, since I may or may not be hosting this radio broadcast from bed myself, we'd open the lines to get your thoughts about eating in bed at 877-301-8970. Do keep a little fold-out tray, like one of our coworkers, incredibly enough, under your bed so you can eat like a withering Victorian woman in isolation for her mysterious ailments. Do keep condiments in the night table next to your bed, as some people do? Or are you an avowed neat freak? Whether you are, well, he wasn't under the weather. This is ridiculous. Meals are to be consumed at a table or at the very least on the couch like a fairly civilized human being. Or you like, did you read about Tyra Banks, who apparently likes to find dried up crumbs in her bed.
Eat them.
And then eats them. The number is 877-301-8970. Can I start? You're going to be shocked, by the way.
Okay.
Because you may not be aware of this. I actually am fairly fond of meals.
I've not noticed, no.
I think you know that. And I don't like eating horizontally.
Jim, you don't eat horizontally when you're in bed. You prop yourself up with pillows or bed rests.
Second argument.
Yeah.
One of the worst, bed is one of the great places in the world. Can we agree on that?
It is great. It is great, especially this time of year when you get your nice flannel sheets.
Do you know what's horrible in bed?
What?
Crumbs.
Crumbs
in your
are horrible.
Damn bed.
Terrible.
It's sort of like the Princess and the Pea. Was that what it was called?
Yeah.
You can have a little breadcrumb in your bed, and you can, don't matter how big you are. I'm rather large. You can feel the damn crumb. Not to mention that it's unsanitary. So and it's not just because Trump likes it. There are some things that he must like that I do. I am not an eat in bed kind of person, even though maybe on your birthday, if your kids, your partner, or whoever serves you breakfast in bed, that's the one acceptable alternative. By the way, one of our colleagues wrote, Jim is the princess and the pea. Well, thank you. That's the way I look at myself. It really means a lot to me.
Here's a good text. Eating in bed, bad. Morning coffee in bed, better. Cold Manhattan in a hot bath, best.
Well, that's a different kind of thing. That's like a sexual kind of thing, is it not?
I don't think it was necessarily a
sexual. If you're having Manhattan in a hot tub, I would assume you're going for it.
Well,
don't you think?
It depends how big the tub is, I guess, Jim. If it's in your own tub, it might just be enough room for you in the Manhattan.
Did you read the story in The Guardian about I think it's a woman who has soy sauce, chili sauce,
she got everything.
Mustard packets, and everything in her night table.
In her night table, right next to Tabasco. Yeah, she said she learned to keep a little collection of condiments. And this is somebody who's a chef in her real life, I think.
Didn't know that.
Is it a chef?
I don't know.
I think so, yeah. She said she loves it. She loves it. She loves to have. But a lot of other people think it's really disgusting. You know what would be really horrible? No. Potato chips in bed. I mean, imagine you eat potato chips, no matter where you eat potato chips, you get little pieces of potato chips all over the place. Well, this person is also talking about eating potato chips in bed. And then this other person, one of these am I the a-hole things, but it isn't really an a-hole thing. This person is writing to advice columnists and asking, my boyfriend will only eat while in bed watching TV, and I have to clean up after him.
And she has to sit on a stool next to the bed, dump the guy.
Yeah,
I mean, that's ridiculous.
That was the advice Anna gave. Get rid of him. Get rid of him.
By the way, to get you in the mood about Trump's eating habits, and this doesn't relate really to bed, Trump was supposed to talk about affordability at this gathering of McDonald's franchise partners and suppliers earlier in November. Instead, here's what the President of the United States had to say.
I like the fish. I like it. You could do a little bit more tartar sauce someplace. Seriously. I hate when I said, do you have any tartar sauce? Do you understand that? Yes, I do. You understand that?
Let me tell you something. I've had this experience. Getting tartar sauce on your pillow is one of the worst experiences you can ever have.
So let me be clear here. You're not a fan of eating in bed.
No, because one, let's start, as I say, horizontal is not a way to
You
eat.
don't eat horizontal. You sit up.
I heard you the first time. Now, when you sit up...
You'd choke if you ate lying down.
Well, that's a reason not to do it.
Yeah.
The second reason is even when you're sitting up, as you suggest, do you ever sit at a table and you get crumbs on the table?
Yeah, lots of times.
Of course.
Yeah,
so you're going to get
lots of
crumbs
times.
in your bed.
Yeah.
And as the princess and the pea, as our coworkers now call me, it's a disgusting kind of thing. And by the way, the whole notion of the President of the United States not liking to eat in the dining room at the White House, but eating in his bed, how does that make, what's your reaction to that?
I think it's kind of pathetic,
Disgusting.
actually. Yeah.
It's
But on the other hand, this person also in the same Guardian piece thinks that the people who think this is outrageous are just pinched people who only see stains and crumbs instead of the deep cocooning pleasure of warm food under warm blankets. Some of my most memorable meals have been in bed, such as homemade vegetarian Scotch eggs with runny yolks, forbidden at pregnancy, that I had in bed days after I had a baby. So maybe if you just get a newborn baby and you're in bed with a newborn baby and you want to get, because people have breakfast in bed. That's like the standard. As we said before, that's the standard.
Yeah.
Mother's Day gift, Father's Day gift, give somebody
When was the
breakfast
last
in bed.
time you had breakfast in bed?
I've never had breakfast in bed.
Well, exactly. It's so ridiculous to even mention it. Almost, you have it like once in your life.
And when the children did volunteer to bring up, pancakes with maple syrup, I mean, really,
Exactly.
I mean, the maple syrup in the bed, that would be a bad thing. 877-301-8970. How do you feel about eating breakfast in bed, which apparently
Not breakfast, any meal. Dinner in bed
dinner
is
in bed.
what
I
this
should have
guy's
said.
eating
Yeah,
here.
I should have said eating your dinner in bed, which apparently the leader of the free world is doing. Mark in Rhode Island, thank you for calling.
Hi, Mark.
Hello. Pardon if I struggle with this. I have a cold.
That's
But
okay.
in the voice of Steve Martin or your AI interpreter, if you want to break up with a woman or a person, take a piece of chocolate, put it in the sheets as you go to bed. You wake up the next morning and you have an excuse to break up.
Wait a minute. Do I think I'm following this?
I think it's rather
Yes, you are.
disgusting.
Yeah. Okay. I think.
Well, that's very helpful to our conversation. You have anything else you want to add or no?
In bed.
Yeah. Have you ever done that, Mark, in Rhode Island?
I've eaten chocolate by mistake in bed.
Yeah. Okay.
Well, thanks for sharing that with us, Mark. We really appreciate it.
Okay.
By the way, if there's anybody who does eat in bed, if you can tell whoever's screening the calls, I'd really like to talk to that person at 877-301-8970.
Did you see a picture of this boyfriend pillow?
I do.
Yeah, I didn't know that was a thing. You get a pillow and you can put your arms around the waist of the boyfriend and he's got his arm around you.
No, actually.
In pillow shape.
No, you're not understanding that. That is actually Mr. Pillow himself will come to your house for $99.99 and he'll put his arm around you as you are.
Okay. I think that's called spooning. Isn't that what it's called? Spooning. People
I think
like
it was called spooning like 100 years ago.
Yeah, well, that's my generation, Jim. 877-301-8970. How do you feel about eating in bed? Do you feel it could be romantic? You're watching TV and you're having maybe ice cream in bed, watching a movie with your partner, or do you think it's just disgusting?
Can I just realize, only because I want to be as honest as I possibly can be, as I'm saying how disgusting this is, I realize there's one exception to this.
What?
And I was reminded
Ice
of
cream
this.
in bed watching a movie?
No. An anonymous texter says, I guess if you can only afford a place with one room, maybe eating in the bedroom makes sense. When I used to commute to New York when I first moved here, and I commuted to New York several days a week, as you know, the night before, I would take a cab from LaGuardia to the Carnegie Delicatessen.
That's right.
Get a corned beef and Swiss that is like as big as my head. I would bring it back to my hotel across the street, and I would eat it on the bed. And the reason I ate it on the bed is for the same reason the guy just said. If you have one room and there's not like a table, you have a corned beef and Swiss on the bed.
Okay.
So in that limited, having said that, as much as I love corned beef from the now closed Carnegie Delicatessen, having little specks of corned beef on your pillow is really not good.
A bed eater, Donna, she just texted and said crumbs or maybe little pieces of popcorn in bed, but I eat it with a spoon, so no messy hands.
Tyra Banks eats popcorn in bed.
Yeah,
Popcorn and ice cream.
Yeah, ice cream. I mean, I think it has a lot to do with if you have a TV in your bedroom. You know, if you have a TV in your bedroom, you might be doing a lot of TV watching in your bedroom, so maybe that's why people do it. But then you have to be careful you don't fall asleep with your dinner.
Ice cream in your crotch or something. I mean, think about that. I'm serious. You're holding it in your lap, and all of a sudden, horrible outcome.
Jane in East Boston, thank you for calling.
Hello, Jay. What's your deal?
Hi.
Hi.
Jane.
Oh, Jane, sorry.
I eat in bed all the time, almost nonstop. Like, it's the only place I eat.
Why is that? Why is that?
I don't know. It's just more comfortable. I can watch television. I'm laying down. Oh, and the biggest reason is because I get tired from eating. So then after I eat, I can just go to sleep.
So what do you do with the leftovers from what you were started to eat in bed? Where do you put them?
Well, I usually only serve small portions to myself.
Okay.
And then, so then there is leftover. But then I leave the dishes on the nightstand frequently.
Okay.
Kind of a bad habit.
Now, Jane,
also because of perimenopause, I think I wake up at 3 o'clock every morning and want to eat something.
Oh, the food's sitting right there.
Yeah, so I just have it ready to go.
Well, and how do you feel about the crumb issue? Is that an issue with you or no?
Bugs. Our texters are worried about bugs.
Bugs. That's a very good
crumbs
point.
and bugs.
I'm not worried
cockroaches.
about bugs. Like, I'll put the dishes away afterwards.
Yeah.
And crumbs, like, okay, you get a little crumb, you swipe them out later. I guess it should be cleaner, but my house looks pretty clean.
No, you sound actually fairly healthy. I think I'm good with this in your case.
Thank you.
Thank you.
Thank you for the call, Jane. A texter has a great question for you, Jim.
What is
You've been
it?
telling us about these nighttime sandwiches with an extra slice of Hebrew national salami. Where did you eat those?
When I was a kid, you mean?
Yeah. In bed.
Oh, maybe.
Well, you've been telling the same
Okay,
story.
I ate them in bed.
For 20 years about your
I ate 'em
mother
in bed.
coming in at
30
bedtime, 30 years, with the Hebrew national sandwich with an extra slice
of salami
on top.
I did.
Yeah, and you ate those in bed. So what did you do about the crumbs?
You want to know? I wasn't going to get into this, but when I was done eating, I'd scream, "Hey, Mom, clean it up!" And so she'd run in. She was actually waiting outside the door. She ran in. She vacuumed up whatever mess I'd left behind. Actually, I'd forgotten that. So 2 times I've eaten in bed. The salami sandwiches, which I ate every night in bed, and the corned beef and Swiss from the Carnegie Deli.
Jerry in Cape Cod, thank you for calling.
This is ridiculous that people do this. Go ahead. Except that woman was great. Go ahead.
Thanks for taking my call. Unless you're sick or bedridden, I find it gluttonous and slovenly, and I'm not surprised that President Trump eats in bed. It's sick.
Yeah, apparently he eats at McDonald's a lot in bed, too. So he's got the tartar sauce going, the ketchup. I don't know if he does ketchup on his cheeseburgers or, but he's a big McDonald's guy. So, and the reason apparently he likes McDonald's is because he thinks nobody touches it. It's all wrapped up.
Because then wrapping.
In paper, and he's sort of a little bit of a germophobe.
What's this caller's name? I like your
Jerry.
attitude.
This is Jerry from Cape Cod.
You have very strong opinions. I like it, Jerry. I like the way you expressed yourself slovenly. And did you say disgusting or you said something else? What did you say?
It's disgusting and gluttonous. It rings of all the. It's just nasty.
Okay.
Beautifully put, Jerry. Thank you.
What are you using for a napkin? What's he using for a napkin?
Probably a sheet. You're a genius, Jerry.
Yeah.
That is so true.
They do point out in these stories, Jerry, that if you're eating in bed, you have to change the sheets much more frequently. We have a text from Dan, who I believe might be the Dan that we know here at GBH. He says he eats in bed on weekends. He eats breakfast in bed. You're going to criticize Dan, the boss?
Yes.
I think a lot of people eat breakfast in bed on the weekends, or certainly have
Marjorie,
coffee. How many people that have been long married always talks about how lovely it is that their partner brings them coffee in bed in the morning?
Excuse me.
What?
I just asked you. You probably weren't here for this. I asked you like 5 minutes ago, how many times do you have breakfast in bed? What was your answer?
I said never.
Okay, so when you say a lot of people do it, Dan apparently does it, which is fine if that's what he wants. He works fairly long hours. So
he does work long hours. That's right.
And but don't you want to, when you get out of bed, don't you want to spring out of bed and have coffee in a new setting And seriously, you spring out of that baby.
Spring out of bed.
Spring out of bed.
I think a lot of us crawl out of bed.
But by the way,
I do the countdown. The alarm goes off, and I count to 20. And
can I be clear about this?
And then I count to another 20 and try to get up.
Let me be
go ahead.
clear.
Go
I
ahead,
think
Jim.
you made this point, but I'm going to make it too. If the report was that Donald Trump had breakfast in bed, I think it'd be almost a non-story. The fact that he eats dinner in bed, and I can't even articulate why it's as disgusting as it is. You would agree that is disgusting, correct?
Well, there's something unappealing about him that makes it kind
You think so?
A little bit.
Okay,
yeah.
George Clooney's having dinner in bed. What do you think about that?
George Clooney can have dinner wherever he wants to have dinner. It's kind of like Tom Brady. Can you be sexually harassed? Can Tom Brady sexually harass someone? I think the answer might be no.
That was a great SNL skit. That's right, SNL skit. Thank you very much for your contribution.
Okay, yeah, if you hadn't seen that one, look it up. It's really funny. Bob from Whitenville, thank you for calling.
Hey.
Hey, how you guys doing?
Good.
I think we're good.
So, with my daughters, the rule of thumb is if you're in a studio apartment, you can eat on your bed.
Good point.
If you're not, you don't eat. And in my 35 years of marriage, I've never taken dinner upstairs to my bedroom to eat. This is just weird.
You answered my question by saying it's weird. What do you think it says about the person exactly?
He's going to get a life, you know.
Yeah.
Really, you know, and I will admit.
Yeah.
My wife has her dinner upstairs because she's watching her shows.
Yeah.
I take my dinner to the basement because I'm watching my shows. But if we're going to do a family dinner, I can be there. But I'm not going to my bedroom to watch.
So wait, let's be clear. If you're not having a family dinner, your wife's in the bedroom eating dinner, and you're in the basement eating dinner. Is that what you're saying?
No. She's in the family room.
Oh, in the family room.
She's not going.
Oh, sorry. Okay.
Next to the kitchen, and I have my man cave downstairs.
I bet you do, yeah.
And so that's where I eat. But if we want to eat dinner, then it's like, okay, I'll eat up. My son comes over for dinner, then we eat upstairs. Like,
Got it.
I
like it, and I like your daughter's thesis too. If you're in a studio apartment, you may have no choice. I would make an exception for that. Thank you much for your call. Now, this is one of these things that makes me nervous.
What?
When our team says they have sound for something, which usually is like a
they
big
have sound
mistake.
from Kevin from Auburn, who says the only thing he uses in bed, eats in bed, is whipped cream.
No, there's enough. I'd stop there if I were you. There are other ones like
you
that.
You wild and crazy guy, Kevin.
Don't read the other ones.
I'm not going to read the other ones.
Okay, we have sound, allegedly, of Trump spilling his Big Mac in bed. Let's go for it. Here it is. That's pretty good. Now, for those who haven't heard that, that is the newswoman. I think she was the newswoman, or maybe the actual grape stomper falling out of the grape stomping bucket on television for a newscast and hurting herself badly.
Okay, let's go to Betty in Hingham. Thank you for calling, Betty.
Hey, Betty.
Hi, how are you both?
We're
fine,
good.
Thank you. Thanks for calling.
Okay. I just want to, I don't know if a caller has already said this, but Winston Churchill used to eat in bed all the time.
No. Really?
Yep.
I wouldn't be surprised he ate in the bathtub because he was always in the bathtub or in the bathroom.
Exactly.
Otherwise engaged.
He has some very strange habits.
Very strange.
As much as I hate Donald Trump, I don't really give a crap where he eats. Nor where he craps, actually.
Oh,
that's beautiful.
Thank you.
That is lovely. Well, thanks
right.
for the Churchill reference. We appreciate that. That was good. Thank
okay.
you.
All right.
My ex-wife used to eat hard pretzels in bed and get crumbs all over the bed. It was almost as bad as her having a boyfriend.
Okay, now this is AI, so I'm sure it's true.
Yep.
Winston Churchill ate breakfast in bed every morning, a routine he followed to read newspapers and continue working before starting his day. So it was his breakfast, and we're willing to make exceptions for breakfast. Now, Brian from Paxton says, this is a good one. It's no wonder Melania sleeps in New York. I can just picture Jabba the Hutt now jamming fish sticks down his throat, laying in bed, and whatever. More of the text there. By the way, that may be the reason she apparently is not around her publicly much. You know?
Well, I think they probably have a deal now that doesn't have to be around him very much. They've never had they've always had separate bathrooms, and I think
not
a lot
just
of the
separate
time,
bathrooms,
separate bedrooms,
separate places.
Separate places, yeah.
Yeah.
Okay, here's a text who says, not only is eating in bed great, coffee and toast on a Sunday morning, I give cat treats. And when I had a dog, he had his chews up there too.
Oh, that is really disgusting.
Well,
I'm sorry.
They texted Jim and they said that they love it.
Now, an anonymous texter, another head, the idea that Jim, quote, springs out of bed.
I don't see it. I don't see it either, texter.
Well, maybe in the spring, maybe too strong a verb.
Yeah, spring. Peter in Lexington, thank you for calling.
Hello, Peter in Lexington.
Hey, I just got this out of the blue.
Yeah.
You know, for us, dinner is social time.
Right.
You get together with other people, you
Great
get their
point.
opinions, and find out how they're doing. So if you're eating in bed, it sounds like a person is eating alone, doesn't want to hear anybody else's opinions or find out how anybody else is doing. Sounds miserable.
Yeah.
Well,
okay. I mean, that's a good point.
Well, by the way, in fairness, I mean, dinner is a social thing. If you read into the Michael Wolff report, did you read the whole report?
The Michael Wolff report?
Yeah, in terms of the caller saying eating is a social thing. Apparently, most times when he's eating dinner in bed, Stephen Miller is in bed with him. So it's actually, there is a social aspect to the thing,
well,
too.
South Park says the devil is in bed with him. Have you seen the South Park
Did you see the
thing?
South Park on Hegseth in the last couple of days?
No. But I have something to look forward to.
They really
when the show is
eviscerated
over.
him. Yeah.
Okay, so a lot of you may have missed this movie. It's a great movie, though. It's an old movie from 1986, Heartburn, with Meryl Streep and Jack Nicholson. They were playing. Heartburn was a book written by Nora Ephron about her husband, Bernstein, Carl Bernstein.
From Woodward and Bernstein.
From Woodward and Bernstein. And Bernstein was a big philanderer. And if you haven't read the book Heartburn, it is a riot. And every few pages she puts in a recipe. She's a great writer anyway, puts in a recipe because she was a great food writer. But anyway, here is a clip from the 1986 film Heartburn, starring Meryl Streep and Jack Nicholson, and they are eating spaghetti carbonara in bed while watching TV.
So you just go in the kitchen at 4 a.m. and come back out with this. This is the best spaghetti carbonara I've ever had. I brought her back.
You're making fun of me.
She'll live and I'll get her another body.
You probably think it's very bourgeois to cook for somebody on the first date. You probably think I do this for everybody.
Believe that she could ever be like before. Rachel, I love this. When we're married, I want this once a week.
She's overrated, don't you think?
Yeah. Did you ever see that movie? It's a great Heartburn. Oh, it's a great movie. Yeah.
I got to interview her though. You were pretty jealous.
I did.
On NACN.
You did get to interview her.
She was fabulous.
Yeah, she's terrific. I just saw over the Thanksgiving vacation Little Women that she starred in as Aunt March, the rich lady. Aunt March. Okay, 877-301-8970 is the number, which I shouldn't really say because I noticed that Edgar Buhurk III just walked into the studio, so I guess we're going to switch here.
Why don't you say, Edgar, hey, do you eat in bed, Edgar?
Yeah, here's what we've been discussing. Oh, no, it's Jared. It's Jared. Jared's back.
You didn't even look.
I didn't even look. I was busy looking at the screen. You're back. You had a wonderful Thanksgiving, I understand.
Wait a second.
Wonderful Thanksgiving, yes.
Excuse me. You looked at Jared and said, Edgar's in the studio?
No, I didn't look. I was looking at the phones, and I was looking at the text. I was looking in the other direction. I turned around, and it's Jared who just slipped in after his wonderful time away.
And I'm delighted at how excited you were that it's me.
I am excited it's you. Later on, you're going to tell me about your wonderful vacation. But right now, we have a very crucial question. You want to take and do the over-under on this one, Jim?
I've been listening.
Yes.
There's no way
Eating
he is ever
dinner in bed.
As Charles Dickens said, there's only one thing you do in bed. He didn't really say that, but no, you don't eat in bed.
No, I think it's pretty. Although people have breakfast in bed. Haven't you heard the couples that
In
are
a
married for a
hotel.
long time, they say, "Oh, my partner brings me coffee in bed every morning," and they see that's the.
Well, coffee's a little different.
Coffee's a little different, so you
I
wouldn't
have
mind
had
that.
coffee, yeah.
You could spill
By
coffee
the
on the
way,
sheets really easily.
You know, Jared was joking a minute ago. I assume at least Marjorie, because you're a literary kind of person, knows it's the best of times is the worst time. Best of times was a good restaurant. Worst of times was eating in bed. Did you know that, Jared, or you didn't know that?
I did know that, actually.
Which book is that from, Jim?
It's from here to eternity, I believe. It's one of his great words.
Cities,
I love how he dropped with the from on that one. It's just,
thought he was
going
to really get us there, and he didn't know the book it was from.
Okay, what are you doing on the show?
On the Culture Show, we're going to be talking to Ethan Hawke. He's coming to town because he's getting the Coolidge Award on Wednesday.
Yeah.
He'll be honored, and I have the honor of interviewing him on stage. So before we do that, we'll talk to him on the show.
We're talking to him, too.
Yeah, he's such a nice guy.
I'm so excited.
Peter Drummey, the chief librarian at the Massachusetts Historical Society, whom David McCullough once, where I was doing a shoot with him for the John Adams book, he said Peter Drummey is a national treasure. He has just retired after 47 years, so we'll talk about his love of history and all of the treasures there. And then we'll talk to Matthew Schifrin, who has a new initiative where he's making instrumental music accessible to deaf audiences, basically by way of storytelling through American Sign Language.
That's going to be a good one.
Yeah.
And good for you for interviewing Ethan Hawke at the Coolidge. That's going to be great. Is that Wednesday night?
It's Wednesday night.
Is it sold out?
I think it's close to sold out.
Yeah, I bet it is.
By the way, can I make one correction? I think it was the best of times, it was the worst times, is from Lassie Come Home. I believe that's I'm pretty sure that was...
Okay.
See you, Jared.
See ya.
Jared, glad to have you back. And your listeners at the Culture Show will be glad you're back too. The Culture Show starts right after we are done.
That's the way it works.
Thank you all for listening for another edition of Boston Public Radio. We're keeping our fingers crossed that Jim, who's just barreled through today, despite having COVID.
A lot better.
You sound a lot better.
Thank
Going to
you.
be with us tomorrow at the library if he follows all the rules about that kind of stuff. Keep up with the 24/7 way of our podcast, or check out our TikTok page at Boston Public Radio, which is really fun. Tune in tomorrow. As I said, we're going to be live at the Boston Public Library. CNN's John King is on Zoom, as is Ethan Hawke, the great actor. Keith Lockhart, conductor of the Boston Pops, will actually be there in person, as will the Boston Foundation's Lee Pelton. We want to thank our crew, Zoe Matthews, Aidan Conley, Nicole Garcia, Hannah Loss, Maddie Geyer ran our YouTube stream today. Our engineer is John DeClaw Parker. Our executive producer is Jane Bologna. And one more time, stay tuned to the Culture Show with Jared Bowen, who has returned triumphant from his Thanksgiving vacation. Jared and the gang are going to start immediately after we do on 89.7 GBH. I'm Marjorie Egan.
Sorry, that wasn't intentional. I'm Jim Browning. Sorry. So that's funny, Marjorie. Thank you. Sorry. Bye.
Okay. Thanks for tuning in. Have a great day.
See ya.
First, Peter Drummey. For nearly half a century, he helped bring history alive at the Massachusetts Historical Society. As its longtime librarian and chief historian, he connected scholars and storytellers with the manuscripts and materials that deepen our understanding of the past. David McCullough told me Drummey is a national treasure. Now newly retired, the lionized librarian looks back on a life spent inside the archives. And Culture Show contributor Matthew Schifrin, founder of Bricks for the Blind, he's making instrumental music accessible to deaf audiences by transforming musical compositions into short stories performed in American Sign Language. That's all right now on The Culture Show.
The Culture Show is made possible in part by a generous contribution from the Fiducia Fund, proud to support this station's arts and culture programming.
I'm Jared Bowen. This is The Culture Show, live on 89.7 and streaming on the GBH News YouTube channel. History is a guide to navigation in perilous times. History is who we are and why we are the way we are. Those are the words of the late historian David McCullough as he described the importance of understanding the past. And for nearly 50 years, one of the people making all that understanding possible has been Peter Drummey. Guided by a passion for old letters, long-maintained manuscripts, and the thrill of uncovering lives lived long before our own, Drummey became an essential steward at the Massachusetts Historical Society, the nation's oldest. As its longtime librarian and most recently its chief historian, he helped generations of researchers navigate one of the country's richest archives. He also brought that expertise far beyond the building's walls, working with storytellers and filmmakers, including advising McCullough himself. Last month, Drummey retired, marking the close of a remarkable chapter in the Society's own history. He joins us to take stock of his career and the stories he spent a lifetime helping others discover. Peter Drummey, welcome back to The Culture Show. It's great to have you here.
It's always my pleasure.
Well, and I hope, even though you're retired from that job, you did not get my permission nor anybody else's I have heard throughout town. You are welcome back on this show anytime, because you are, as David McCullough once told me, as I've shared with our listeners before, he called you a national treasure because you are.
Well, it's very flattering. I always think it's the things that we have, or the Massachusetts Historical Society has, that it's not about me, it's about the thing, making these things. Documents don't speak on their own. You have to bring them to people and help them with understanding not what people thought necessarily, but how they wrote and expressed themselves in the past.
But I think it's fair to say that these documents in manuscripts and collections speak to you in a different way.
Yes, that's the kind of the great pleasure of my career, is to have this direct contact with materials from the past. That is, what's written, the intellectual content of documents is, of course, the primary thing, but the physical document itself, and having held things in your hands or touched them and showed them to people and told someone they could hold the letter where Abigail Adams desires that John Adams, away in Philadelphia, will remember the ladies when they write a Declaration of Independency, as she called it.
Well, I was thinking about, we've done so many stories together over the years, and I was wondering what your take is on how these letters were recorded. Of course, they're recorded in all different manners, whether it's diaries or letters or proclamations. But did you come to a point where you understood that maybe this person was thinking that this would be read more widely someday, and this is very intentional beyond something intimate?
I think that it catches you by surprise when someone writes a personal, intimate letter, a love letter, and then has, especially in the 17th and 18th century, the expectation that someone else will see it. That is, a wonderful example of this is when, during the siege of Boston, there's John Adams is away in Philadelphia at the Continental Congress, and a person there named William Barrow comes to Adams and says, "Do you have any news from home?" That is not direct news because the Adams family is outside of Boston, but just having news from near there. And so John Adams gives this young man Barrow letters from Abigail Adams, which are personal and intimate, to read just to fulfill this idea of news from home or near home, just outside of Boston. And it's very endearing because it's a lot of detailed accounts of what's happening and who's doing what and where the military operations, kind of eyewitness account at considerable detail. And then Abigail Adams ends, and people who have seen the musical 1776 will know about this. She ends by saying, because everything manufactured came to Massachusetts essentially through Boston. So she says, she writes as an addendum to her letter, "Could you send me some pins from Philadelphia? You couldn't get a pin for any price." This sort of a matter of everyday life that she's just lacking, and he will pay on her behalf any price to get them. And William Barrow brings these letters that he's been loaned just to have something near home because there's no contact with his own family, his sister and brother-in-law in Boston. And he brings a big bag of pins. And it's just this, people are giving you a description of this epical events, really, and the most extraordinary events in American history in some respects. And then at the same time, there's this personal, intimate moment, but it's only in going across a line that I think we might think a zone of privacy around a personal letter from wife to husband. And so John Adams writes back, and he goes through all of the reply to her letter, and just as an aside at the end of his letter said, "Oh, I have a big bag of pins for you that this young man sort of reading your letter has fulfilled, brought in to me to send on to you."
Well, you paint such a cinematic picture, as you have done for historians, as we've done again in our stories over the years, as you just did. I wonder what it's like for you to see the depictions of history, how the historians have ultimately written what you've put before them, or maybe it's two separate questions, but how you the television and film industries.
This is really one of the things that was hard for me to get used to when I started being asked a lot of reference questions. And I've been doing this so long that when there was a movie being made about Thomas Jefferson in Paris,
Yeah.
And I liked the movie quite a bit, perhaps knowing too much about it to really like it. And the two things I'll never forget is they would call on the telephone from Paris, because and it's sort of not. Mostly they had questions that they couldn't be answered easily in a telephone conversation. This is how long ago this was, and the things that I remember about it would be they're seeing everything visually. So to say, they'll want to show Jefferson, a large man, writing in his minute, careful handwriting and account book, and it just looks wrong for them. So they want permission to have him write in a large, large paper and a large volume, of just so that it'll look like what you expect it to look like. And they'll also, have to be reminded that when he wrote this, it was on stark white paper with jet black ink, that the world was not beige and brown as we see it historically, and they'll think, well, if we show that, it's going to distract people from what we're trying to show them. And last, I won't be able to remember the actor that played Jefferson in it, but they were trying to figure out what Jefferson looked like at this period of his life in the 1780s. And they were trying to arrange makeup to make their actor look more like Jefferson. And I bit my tongue rather than say, wouldn't it have been better to start out with someone more like Jefferson, who looked more like Jefferson, than have to try to backfill this? But that was a long time ago, and the world has sort of shifted on. But that idea, an extraordinarily a wonderful historian was hired to be the sort of advisor when they were making the movie about the Amistad case.
Oh, of course.
And this is
a Spielberg film. Right?
Yes, a Spielberg film, and an expert on slavery in Cuba they had on the set. And she told me that during the course of her time giving this expert advice, with all these things that came up and just were passed over, they once asked her what the Spanish flag that would be flying over a slave quarters in the Spanish flag, what it would look like. And she thought, gee, but hire someone to have their credential rather than actually be looking for their advice. But it's been a pleasure and to some extent amusing to play a part in that.
Why because I know you'll know the answer to this, why did Jefferson have such a small script?
He's, and this is an interesting thing about someone who's trying to control things. So it wasn't just that he has a small, careful script. He actually, at first, I think I thought of this as some sort of grammatical reform that he was trying to implement. But he wouldn't capitalize, he'd only capitalize the first word in a paragraph rather than in a sentence or proper names and things within us. So he'd make this even script, almost like an inscription in stone or something like. But I think it's that idea of sort of controlling his emotions, having this sort of, and also being carefully precise. He also copied all of his own letters, which is now often people did, so we could retain a copy. Often people would do that, but often there'd be a secretary who would do that.
I would definitely outsource that.
Who was the president when he was doing many of these letters. But I think the idea was that he would have made the copies and he would have the copy he retained. That it kind of also created a sort of zone of privacy. And he loved the technical improvements. So he had a machine that he called a polygraph, but in fact was a copying machine that an architect would use to be able to, with an arm, have a pen to write with and an arm that would have a separate pen. And so as you drew a drawing, you could make an exact copy or you could make an enlarged or reduced copy, a pantograph, this is called now, and which must have been extraordinarily difficult to manipulate. For a long time, people thought he invented this. He, in fact, improved on an architectural device, but it meant he could send you a letter and you'd receive it, and then he would have essentially an exact copy of it himself. And that wasn't, it was good to have copies of when you sent letters to people at a distance, but I think there was more going on there than that. Than just having a copy for an aid to memory.
A psychologist could perhaps help us.
Oh, well, that's
too.
Yeah.
Well, I think.
No, that's
we'll get off topic.
Yeah.
But hearing you just describe this so meticulously, I wonder what you think of where we are now. And what the Peter Drummys of 300 years from now will do when there is no written archive.
Yes, for about another generation, things will be there'll be more paper in the world than ever before. But that's all things essentially that have already been written. But what we went from as being essentially never enough information about the past to historians who have tried to struggle through enormous bodies of records to find important things within them. So that's the paradox is just before it's not the end of history, but it's the end of history as with the sources we've used And what we have available to us is shifting right now so dramatically. And there's a couple of things that are more philosophical than practical, but what's the purpose of a physical repository for records that never had a physical existence? That is, what will a place like the Massachusetts Historical Society look like on into the future? The other thing is, on the way there's big gaps have opened up. Now, there's always been losses through war and fire, destruction of records, but digital records, digital records, for a long time, because people were using proprietary methods of making writing online, that there are. It's not that these things can't be cracked, that they can't be opened or used, but the expense and time in doing it means that it's very difficult to justify the expense of trying to make accessible digital records. Then a lot of records were simply overwritten, that the decision was made that or people have sort of disappeared them, which is, of course, relatively easier to do than where there were perhaps multiple copies of paper records written on paper or recorded on paper in different places. That that systematic erasure was perhaps more challenging than it is to people right now.
Let me leave with, only for now, because again, we'll have you back on the show many times, but how do you explain to somebody in this moment how we will hold on to fact here on out in this age of AI and how quickly we're losing our sense of what is real because we can really no longer trust an image?
Well, first we have to be careful, and this is only an aside, but there's been fake news for a long time, and much of it done in good purposes. There, in Boston before the revolution, there'd be notes in the paper, there'd be an essay or a letter or something from a cited source, the Chronicle of Events, a newspaper that supposedly was published elsewhere, and then they'd be reprinted in Boston that would give newspaper printers some cover. But in fact, this newspaper never existed. It was all manufactured by people who were trying to exaggerate the oppression of the British Army garrisoning Boston before the Revolution. So that's not to justify or reassure about anything today. It's much, much more severe problem, but it is something that has a much longer history than people. I think people would be surprised how long people have been trying to do this, essentially manipulate news by exaggeration or simply falsehood. And that means that out into the future, I have a feeling there's going to come a time when discerning what is, especially something like an image, what is an accurate image and what is a manipulated image. I mean, photographs have been manipulated since the introduction of photography, but I don't think there's anything like what has happened, gone beyond essentially people's imagining how far this could go so quickly. And that's a problem for the future.
Well, I will take a little bit of relief in knowing that it has happened before as you've described it, because even though it's not with the same severity, we have come through it, as history always reminds us. It is prologue, as you have always helped us understand. It is prologue. Peter Drummy, thank you for being here. Congratulations on your retirement.
Thank you very much, and it's always my pleasure.
Peter Drummey was, until recently, chief historian for the Massachusetts Historical Society. He has retired after 47 years there. Peter Drummey, again, thank you. And coming up, actor, filmmaker, and producer Ethan Hawke is heading to the Coolidge Corner Theater this week to receive the 2025 Coolidge Award. But first, he joins me next on The Culture Show. Stay with us.
The Culture Show is made possible in part by a generous contribution from the Fiducia Fund. proud to support this station's arts and culture programming.
Jamaica's recovery plan following Hurricane Melissa will cost an estimated $8 billion. Now officials need to decide whether to rebuild with wood or switch to concrete.
The technology exists. The implementation is what is key, and just taking the right decision and right choices.
I'm Scott Detrow, rebuilding Jamaica for resilience on All Things Considered from NPR News.
Today at 4, here on GBH News 89.7.
Funding for our programs comes from you.
And American Repertory Theater with Wonder, a new musical for the whole family based on the best-selling book and beloved movie. This holiday season, Wonder celebrates the power of kindness. amrep.org. And Bonsai Bar, hosting pop-up beginner bonsai workshops at breweries across New England. Hands-on classes provide guidance in the basics of bonsai design and care in a group setting. More at bonsaibar.com.
In Western Avenue Studios in Lowell, home to over 350 artists, with open studios from noon to 5 every first Saturday of the month, with special holiday dates on December 6th and 13th. More at westernavenuestudios.com.
From your neighborhood to your newsfeed, GBH News is your trusted source for the news that matters to you. Find us wherever you are at GBH News and always at GBH 89.7. GBH News, what matters to you.
I'm Jared Bowen. This is The Culture Show on 89.7 and streaming on the GBH News YouTube channel. Few actors of his generation have carved out a career as varied or as restless as Ethan Hawke. He's built a body of work across the full spectrum of filmmaking, from his breakthrough in the Hollywood classic Dead Poets Society, to the intensity of the blockbuster Training Day, to the intimate independent films that revealed a different side of his artistry, like the Before trilogy and Boyhood. But Hawke's practice has made him an artist of many stripes. He's a novelist, a screenwriter, a producer, a documentarian and filmmaker, whose projects, from the acclaimed miniseries The Good Lord Bird to his feature film Blaze, reflect the same curiosity and craft that have marked his time on screen. His prolific career is also accented by his decades-long collaboration with director Richard Linklater. Their 9 projects together have launched Hawke in myriad artistic directions, including in their latest film, Blue Moon. It's all a career the Coolidge Corner Theater is recognizing with their 2025 Coolidge Award, which celebrates a film artist whose work advances the spirit of original and challenging cinema. Ethan Hawke appears at the Coolidge this Wednesday for an afternoon screening of Blue Moon, and at 7 I'll be in conversation with him as a part of the Coolidge Award event. Ethan Hawke, welcome back to The Culture Show, and congratulations on the Coolidge Award.
Thank you. I feel honored and privileged, and I have a bounce in my step. I feel like I'm somebody.
Well, of course you're somebody, but
we're all somebody.
This has been a moment for you to look at your career. I'm sure take stock of all that you've done, especially as other people are doing it for you, as we'll talk about. How do you look at this moment and this point in your career and what you've accomplished?
Well, I don't know. It's been particularly interesting this year having Robert Redford pass, and like this last weekend having Tom Stoppard pass. Those are 2 men in my life that were real North Stars, and I knew them a little bit and felt honored to have their mentorship. And one of the things that I guess, if you're lucky, happens to you as you get older is you get pushed into that room where your job is to help other people. And I start thinking about all the people that helped me. Those 2 men I mentioned, just to pick 2 of the many people that helped me, they didn't have to. You know, it didn't help further their careers one little bit to be gentle and kind and supportive of me on my road. And so it's bending my brain to think about, wow, if I'm at this point in the race, I have to start thinking like the people I admired thought.
Well, the interesting thread in those 2 gentlemen, Redford and Stoppard and you, it's so clear how much you all love the work, how how much you kept evolving the work and you stayed with the work as opposed to people who maybe check in and out. How fundamental do you think that is to that?
It's fundamental to my ethos. I mean, I don't know, there's negative sides to it, but when I was young, there was such a big thing about who was selling out, who was not selling out, and it seems to have been lost. It's like you're just a sucker if you don't sell out now. But there was an ethos to that I really admired. I heard a story this morning. Somebody told me about Stoppard that really made me laugh. I don't know if it's true or not, but it's fun. It matches the personality of the man I know, which was that Spielberg asked him to adapt Jaws for a film. And he said, he was writing a play for the BBC. And Spielberg said, "You mean you're going to turn me, Hollywood, on all blockbuster money down to write a play for BBC television?" And Tom said, "Well, it's BBC radio." But the reason why this story makes me laugh is he followed his own compass. And he took inventory of himself, not the status of what society thought about him, or to constantly justify anything that paid him more money. Because there he was in his 80s writing his last play, Leopoldenstock, and it was brilliant. It was a kind of play that only an older person could write. It was full of all the intelligence that we relate to him and think of with him, but it has this deep wisdom of time and the things that you could only learn through the value of living a long time. And so that was the ethos I grew up admiring. Redford was the first person I heard speak about the environment. He started the Sundance Film Festival that was obsessed with giving back, creating space for new voices. This is a guy who's on top of the world, right? And he's taken months out of every year to spend making sure that there's a larger path behind him. And I just admire it so much. And it's this moment, and all this kind of people being nice to me means, well, maybe I have enough grease to smooth out the rails for other people. And if I should.
And to also do what you love. I mean, this is what's clear to me as I've been looking back at your entire career and looking at the choices you've made. It seems to me anyway, that you just love film. Can you describe, do you have a sense of why it is you love this so much?
I don't know. I was thinking about that. It was Thanksgiving this weekend and everything. And this morning, my son was texting me about how great the series Andor is, right? And I was texting him, yeah, it was great. And I was thinking about, I think one of the happiest moments of my life, I remember watching Empire Strikes Back with my father. And we sat for like 2 hours at the kitchen table. We're thinking about, what did Yoda mean when he said, there is another Skywalker, or whatever he said. And I started laughing to myself about how much joy movies have brought to me, how much they expand your universe in the ways in which you think, whether you're talking about, my dad taking me Empire Strikes Back or my mom taking me to Claire's Knee, when I saw Paris, Texas, to when I saw Raiders of the Lost Ark. There's my love of cinema is extremely expansive. I love a lot of the genres. I guess I love the Cassavetes quote, which is, I love any movie that somebody put thought into. I don't care if it's Bergman film or a horror film or a Star Wars film. If somebody put thought and care and love into it, so they're not wasting my time. Most people have to work for a living. They got very little time for entertainment. And the best kind of entertainment is like a great meal. It leaves you nourished. It didn't just satiate some hunger. It's not candy, And so I've just dedicated my life to it because I love it. And I think a lot of people don't go to church. And the artist's responsibility is to bend people's minds back towards a substantive conversation.
Well, speaking of putting your all into it, you certainly did that with Blue Moon. I want to play a scene from the film in which your character, the brilliant and troubled lyricist Lorenz Hart, reviews his former collaborator's new hit musical, that would be Rogers, Oklahoma.
What did I think of Oklahoma? I saw the show a couple of times in previews in New Haven back when they were still calling it Away We Go! ! And I felt sure Dick was going to call me. Larry, we're in big trouble. I need you to funny up the show. We need some big comedy numbers. And I was all ready to say, Dick, instead of all this corn pone Americana, let's do a send-up of corn pone Americana. I was already writing lyrics in my head. I couldn't stop.
And did he call you?
Are you kidding? He was too busy writing more hits. Huh.
You have talked about that this was one of the more challenging roles for you. And again, I guess apropos of what we were just talking about, you don't have to take on challenging roles at this point, but you are.
Well, someday I'll be dead. I mean, it's a thrill to do the challenges, you know? And when you have a piece of writing like this, you know, that's a little taste you see of it, but the screenplay is like chock-a-block with things I want to quote. And the actor's job, right, is to share with an audience a love of a good writing. That's at its fundamental value. When you get up on stage to play Hamlet, you're saying, hey, listen to this line. Isn't this a fantastic idea? Pay attention to this. This is really worth your time. And when you find a piece of writing that makes you, I remember my wife and I were reading The Good Lord Bird, and we just had this feeling of like, I want to give everyone this book for Christmas. You know, everyone I know, everyone I love, I want to read this book. And then you have this realization, oh, let's make a movie out of it. That's one way we could kind of do that. And so in a way it's challenging, and people say it's hard, and it is hard. It was hard, but it's worth it. I had volumes to memorize for that movie, but I spent hours memorizing it, and I just giggle myself to sleep at night trying to learn these lines because they were so funny.
What else made it hard for you?
Well, he's an alcoholic, and he's self-loathing, and he kind of knows he's going to die, and he knows he's kind of responsible for that. And it's like he's being left behind on an iceberg. You know, the movie takes place at a moment. It's not just the end of his artistic friendship with Rogers. It's the end of an era. It's the end of the jazz age, and a new thing is starting. A new wave of commercial work is changing, and he doesn't like it. He doesn't want to move on. The genius of Rogers is he could change with the time and keep writing beautiful music. Larry Hart wanted to keep doing what they were doing in the way that they were doing it, which is drinking and partying and writing these funny songs and doing his jazz. And it wasn't going to happen. And so in a lot of ways, I knew I was playing a man who is, by going to this party, it's like he's walking in front of a firing squad. This second he walks in that door, and he's going to try to talk his way out of it, but it's what's going to happen. And that's challenging. The fact that Larry Hart was about a foot smaller than me created a math problem. The fact that he had this blistering intelligence combined with profound sadness. So I'm playing this person who's the funniest person in the room, who's the saddest person in the room. It's hard to do. The challenge of this part was that I'm always playing two notes: really confident, deeply insecure, vain and bitter, warm and empathetic. He's a homosexual. He's in love with a woman. It was all the correlation of opposites, you know, and it created if you do it right, it creates this feeling like you're watching a spinning top, like you can't take your eyes off a spinning top because it's going to topple any second. And if you get a part like that, it's really exciting, but it's very difficult.
Which leads me to my favorite question to ask actors. And it just dawned on me that the first time I ever asked this is going to sound like name dropping, but it's so apropos, was when Meryl Streep received the Coolidge Award.
All right, now we're in the deep end of the pool.
And I asked her this question about whether, given all that you just talked about, the challenges of playing a character of that nature, whether it stayed with her. She said no, she could just go home and take care of the kids. And then I was talking to Kevin Kline, who was also honoring her that night, and he said that he would be wrecked doing Sophie's Choice. He could barely stand up at the end of the day, and he couldn't understand how Meryl Streep would just talk to him about going home to do laundry and things of that nature. So where do these characters, how long and how deeply do they sit with you while you're filming and after?
It's so interesting that she would say that. It's somehow connected to the depth of her power and the longevity of her career. It's really interesting that you tell that story. Most of us can't do that. I met the great actor Mark Rylance once, and he gave me great counsel and advice in a brief meeting about the ability to let go of parts and how important it was that young actors spend a tremendous energy trying to get, quote unquote, into character. And they work so hard to understand this character. And what are you doing to release it, to let it flow through you? Because a lot of times these texts that we get asked to recite are like a guided meditation. You always hear the whole Buddhist expression, like if you want to be happy, just sit still for a minute and make yourself smile for 5 minutes. And strangely, if you do that, it kind of works. It does put you in a good mood. Your body chemistry is such that you can work with it. But this inverse of that is true too, which is if you play Macbeth 8 shows a week, it's a guided meditation on hate, power, lust, and greed. And it contorts your face in a different way. And it's very hard to shake off. And I think people like Meryl Streep and Mark Rylance get very good at continuing to play, to keep it like a child. Children are beautiful. There's no shame in calling it child's play. It's like the power of kids' imaginations is so intense, and they don't take it home with them. You can let all these energy and things flow through you and really deliver them to an audience and still remember who you are. But I do think it's active mental work. And a lot of American actors aren't really taught that. And I would credit Meryl's ability to do that she had really proper training. And she played a lot of hard parts as a young person before she was ready, and had a lot of great teachers that helped her let her talent work for her and not let it hurt her.
For people just tuning in, I'm speaking with Ethan Hawke, who is receiving the Coolidge Award at the Coolidge Corner Theater on Wednesday, where he'll be there for a screening and to be honored that night, a screening that is of his new film, Blue Moon. Well, if you are talking about her education, for instance, when you look back at who you are as an actor now to who you were when you started out, again, so young, Dead Poets Society, and before that, how do you look at that young man versus who you are today?
Well, I don't know about other people, but I hear people say this kind of thing. It doesn't feel like that long ago. I feel like the same person. I mean, what's interesting about making a movie with Richard Linklater, I met him in 92. And I feel like we've just been talking, and wow, it's turned out to be over 30 years we've been talking. These movies are a result of a really long, elaborate conversation and a shared passion. We all know this, that, my spouse makes up a huge part of who I am. She's been a great friend and ally and resource, and a person who you bounce ideas off of, and you create yourselves together, when you start a family and are running a home, and we run a business together too. And so that's a big part of my life. And yeah, Peter Weir, Dead Poets Society, Robin Williams, Philip Seymour Hoffman, Denzel Washington, Sally Hawkins, Laura Linney. These people are foundational to moments of my life where I've really intersected in challenging ways with my profession that have inspired me, and they're a part of me now. They're a part of the way that I think. And then also, so is just great art I've seen. It's a part of me. It lives as, Anna Karenina, or Tom Stoppard's Arcadia. There's some, the Steppenwolf Theater Company. They live just like it gives you something to admire and chase. Martin Scorsese, Spike Lee. There's all these things that are like, oh, this job's worth doing because if I could do it that well, that would be cool.
So how do you look at the future then? I think it's so interesting because I share that same belief that I feel like I'm just getting started and well into this crew. We're both Gen X. So how do you see what you do going forward?
Well, I don't have a clear vision for it, but I never have. I've always done what really interested in me in the moment. I've had two things. I think I've been blessed with a strong intuition that I respect and listen to, and I finish what I start. And those two things are, because if you don't finish what you start, that's it doesn't give yourself achievable goals. I started with small achievable goals. I'm a big believer in that. Like, don't try to change the world, just try to change your house. And meaning I started a little theater company and tried to make little tiny art that I really believed in. And I learned so much in my early 20s running a theater company because, it's the same. When you get more money, running a theater company was the same thing as trying to run the set of Good Lord Bird. It's people, dynamics. Yeah, there's more money at play, but the goals and the things that mess it up or make it go well are the same. And so I've just had my whole life I guess maybe that's why I'm an actor at heart, is I kind of can see about 18 months ahead and not much farther. I can kind of see the next couple jobs. And when I get tired or bored's the wrong word, but if I lose my sense of joy or enthusiasm, I just do something else. I'll make a documentary or do a play, and then everything gets new again. Write a graphic novel. I put myself in beginner's mind as much as possible. By the time I direct another movie, it'll have been so long that I'll feel like a child at it again. But that's not bad. It keeps you humble, it keeps you interested, and it keeps you listening to other people. At least that's the game I play with myself that works.
Well, Ethan Hawke, it's always great to speak with you. We just scratched the surface here. I can't wait to talk to you about your films on stage at the Coolidge on Wednesday. Thank you so much for being with us, and again, congratulations.
Well, I look forward to seeing you. It's going to be fun to be up there. Can't wait.
Ethan Hawke is an actor, writer, producer, and filmmaker. He is the recipient of the 2025 Coolidge Award. This Wednesday, he'll appear at the Coolidge Corner Theater for an afternoon screening of Blue Moon. And that night, he'll be in conversation with me as part of the Coolidge Award ceremony. To learn more, go to coolidge.org. Coming up, Matthew Schifrin, founder of He's making music accessible for deaf audiences. He's next on The Culture Show. Stay with us.
Shenzhen is a sprawling city in China, home to more than 17 million people. Just half a century ago, though, it was completely different.
At the very beginning, it's a very small village, actually. There's not a lot of people living here.
We look at how Shenzhen grew so quickly and whether that growth is sustainable. Next time on The World.
This afternoon at 3, here on GBH News 89.7.
Our programs are made possible thanks to you.
And the Museum of Fine Arts, Boston, presenting the luminous watercolors of Winslow Homer, together for the first time in a generation, of light and air. Winslow Homer in watercolor is on view now. More at mfa.org. And Boston Ballet, presenting The Nutcracker. This holiday tradition mesmerizes audiences of all ages with beloved characters and Tchaikovsky's memorable score. On stage now through December 28th. Official tickets at bostonballet.org. And Heights Crossing, an assisted living and memory support community offering residents experiences aimed at promoting independence, inspiring curiosity, and encouraging connection with others. More at heightscrossing.com.
GBH Daily is a newsletter that keeps you informed, connected, and ready to go every weekday morning. You can subscribe today and get it in your inbox at gbh.org/daily.
I'm Jared Bowen. This is The Culture Show, live on 89.7 and streaming on the GBH News YouTube channel. It's time for our recurring feature, AI Actual Intelligence, where we tap into the most interesting thinkers in our region. Their original and algorithm-free insights and observations are very useful to us. We're joined now by Matthew Schifrin, founder and CEO of Bricks for the Blind, a Boston nonprofit that translates Lego's visual instructions into words, giving people with vision loss the opportunity to build. This month, we're focusing on the work that he's doing to make music accessible to the hearing impaired. Matthew, welcome back to The Culture Show. Great to have you here once again.
Thank you so much. Great to be here, Jared.
Well, before we start, you're going to walk us through this process, which is fascinating, but this is a collaboration you're doing with Think Outside the Vox.
Oh, they're a fantastic organization.
So fantastic, we've already featured them on the show.
Absolutely.
But to jog people's memory for what they do.
They create accessibility for theater performances and museum exhibits, and they provide audio description, descriptive narration for blind people. They also provide sign language interpretation, and they also teach directors of artistic sign language, who are the deaf people, who are making sure that what the interpreters say is as expressive as possible. And also they train these audio describers, these descriptive narrators, who are telling you what's happening when you're, as a blind person, sitting and listening to a play.
And how did you come to collaborate with them and see potential and opportunity here?
I was a user expert with them, doing analysis of their plays that they were describing. And this came about as a really interesting sidebar. Kristen Johnson, the deaf director of artistic sign language on this musical project that we made, she and I went to a concert together, and it was very florid Baroque classical music. And if you're blind, well, it's Baroque classical music. If you're deaf, it is supremely boring.
Yeah.
And I said to her, I will text you. I will sit next to you. I will text you descriptions of the music as it is happening. We're sitting here together. Let's do this. And she was absolutely laughing because I was giving her descriptions such as, in jazz, trombones swear more than a drunken sailor, for example. And she really liked that. And it was so much fun for her because it made that whole experience accessible. We got in a lot of trouble, though, because it turned out that we were sitting right under the microphone that they were using to live stream. So not only were they getting music, but they were getting very loud computer clacking as I was typing everything out as it was happening. Musical stenography, basically. And afterwards, this project that we did at the Boot Cotton Museum in Lowell, Kristen is not only a director of artistic sign language, but she's also a dramaturg. And so basically I wrote out the story of what these instruments are doing, who they are as characters, kind of like what Disney did with the Fantasia movies or what Prokofiev did with Peter and the Wolf, taking these instruments and giving them characters and backstories and experiences. And Kristen really guided me through that. And not only guided, but she's been doing this type of work for over 30 years. And she has a huge amount of insight and expertise into how to tell stories to deaf audiences that really resonate with them. And so I would give her these stories, and then she would really compress them and provide the essence of them to transform into American Sign Language. Because sign language's syntax is so different from English's, you're not just going to directly translate. The whole methodology needs to change and turn from something that is verbose and wordy and tries to engage us that way into something much more practical and gestural, and something that is carried by the deaf actor who is interpreting this not only through their gestures but also through their face and their body, and all the aspects or the corporeal aspects of them are being used to tell the story.
Well, if you would, walk us through this process. You have selected a piece of music. We have edited it down to about 34 seconds, and you're going to take us through several iterations. But before we take our first listen, which was just the music straight up, describe, if you would, what the piece is.
Sure. This is a piece of kind of contemporary film score and atmospheric music by composer Alison Plant, and it's called Warp and Shift. And it can be heard if you go to the Boot Cotton Museum and to this exhibit. It's one of the pieces that are there. And I just went sound by sound, instrument by instrument, and wrote out exactly what they're doing and how this can contribute to the overall story of these characters in the mill at that time.
All right, so with that exercise, people can think about how they may describe this as well. Let's take a listen to the piece without any information on top of it. All right, so that, again, is one excerpt of this piece. Tell us what we will now hear again, but with your additions.
Yeah, now what you're going to hear is my initial kind of flavoring of it. If a deaf person comes without any sign, if I just give them this text, this is how I would pitch it and immerse a deaf person in this experience. This is before the director of artistic sign language has come and codified it in ASL.
All right, so we'll play the music again, and you're going to do your piece. Okay.
Like sportscast it. A wooden hatch opens and a torrent of water pours through. It's hot and stuffy on the mill floor and smells of river water, metal, and sawdust. A single ethereal note on the violin, barely perceptible. The inkling of an idea, the seed of a concept. Quiet, but it's there. Our first note transforms into a louder, more persistent note as water continues rushing through the hatch, an aquatic backdrop on which our one note floats. A voice appears. Formless, not singing words or vowels, but something in between. There's an uncanniness to it, robotic but almost human. This voice represents the mill girls, worked to the bone in the mills. Our violin appears and swells, becoming more confident, followed by two sharp clicks as a lever is pushed up and pulled down.
This is extraordinary. So first take me through your process, because there is a poetry involved here.
Oh, of course. Basically, all I do, think about radio dramas from the 40s or whatever. Basically, this is when blind people watch a movie, there is a describer narrating what's happening. It's audio description. The man stands up. He peels the banana and carefully places the peel on the kitchen counter, whatever that might be. And all that I'm doing is the same thing, but for sound. And all it is you take the sound that is happening and you add story and you add flavor so that the person can get a sense of time and place and essence. And as you'll see when I talk about the sign language aspect, the sign is going to be much more to the point. And what Kristen Johnson did was she really made me distill it to its elements. And she was very, as a dramaturg, she was very specific about why is this element here and what does this add to the story? Why do we have these mill girls? What are we going to tell you about them? Why do we need this violin? What is it offering practically? And what I really appreciated was the practicality that she offered, because I can do this all day. I can go as deep or as shallow as you want, but to someone who's profoundly deaf, they won't care that we are in C, and they won't care the type of articulation the violin is using. That does not matter. We need to go, we need to zoom out into a more, kind of a more practical, but also a more story-based approach.
So for the third iteration of this, as you just described, we've heard your description. Now these are the instructions, the script, as it were, given to the signers employing ASL at the concert, and how this has been condensed and edited into the most impactful way.
The cool thing is I also got these notes from the actual deaf actress, Olivia Reinenbach, and what she did was she took those signs and she wrote out exactly how she was going to perform them, which you will see, and that's very fascinating to me.
We'll play the music one more time.
Factory, water. Use fist to show water wheel and water running over it. Two wheels rotate backwards. Smoke, dirty, smell. Violin, 2 wheels rotate. Time ticks thrice. Crank lever, pull up. Wheel rotate, stop. Factory girl, vision, dream. Stack 2 fists on top of each other at the side of the head like looking through a telescope. Sing, vision slams closed, bringing girl back to reality. Pressure, tired, sweaty, work, do. Crank, pull up, down. Water wheel chug.
So, what is your understanding, as this has evolved now, of the impact of this and what this descriptive service has allowed deaf people to experience?
The amazing thing is that this will be on the Boot Cotton's website, and this is the first time, to my knowledge, that we have seen transcription of music that is not practical. What I mean by practical is there are vibrating vests, for example, that you can wear, and they will transfer the music on a purely tactile level, and the bass will be on your lower chest, and the treble will be on your upper chest, and other instruments will be on your arms. But the goal here is to really bring the deaf listeners into this experience. And what's also very cool for us is that Kristen there are 6 total pieces, and Kristen found 6 deaf female actors to sign these different pieces. And it's wonderful to really engage deaf people in the whole process, not just in the dramaturgical and crafting portion, but also in the performance. And as deaf people, they know sign best. And sign is made not only, as I said before, the entire body is involved, and they're able to imbue it with their own selves.
We only have about a minute left, but just listening here, and as we've played this, it seems also practical. How widespread is this, and how widespread can it be?
It can be very widespread. This is the first time we've ever done it, but we'd love to spread it wider. If you're interested at all in Think Outside the Vox, they are at thinkoutsidethevox.org, VOX.
And there is lots of opportunity that has just been untapped.
Very. We are here to tap it for you.
As always, Matthew Schifrin, again, always great to have you here. We look forward to seeing you next month.
Same here. Thank you, Jared.
Matthew Schifrin is founder and CEO of Bricks for the Blind, a Boston nonprofit that translates Lego's visual instructions into words, giving people with vision loss the opportunity to build. To learn more, go to bricksfortheblind.org. And again, the organization we were just talking about is Think Outside the Vox. Again, thank you for being here. And thank you for listening to The Culture Show. Tune in tomorrow for actor Jerry O'Connell. He's here to mark the 40th anniversary of the film Stand By Me. The Culture Show crew is Max Chow-Gillette, Kate Dellis, and Chelsea Mers. Our intern is Avery Morin, and today's engineer is Bill Piacitelli. And thanks to Maddie Geyer for producing our YouTube stream. I always say scream. I don't know why it's not a Freudian slip, I promise. It's a YouTube, a stream, and I'm Jared Bowen. Have a great day.
The Culture Show is made possible in part by a generous contribution from the Fiducia Fund, proud to support this station's arts and culture programming.
Spend your afternoon with us. Stay with us for GBH's All Things Considered at 4 and Marketplace at 6:30. But first, the world. A global view of today's headlines from the World Newsroom. Right here on GBH 89.7.
Support for our programs comes from you.
And the Office of the Massachusetts State Treasurer. The Unclaimed Property Division is holding unclaimed funds. New properties are added often. To see if you have unclaimed money, you can visit findmassmoney.gov.
Every story has its twists and turns, so let the PBS NewsHour set the record straight. Get the facts you need from America's most trusted news source. Don't miss PBS NewsHour, weeknights at 6 on GBH2.
If you have a vehicle that feels beyond repair, donate it to GBH to help keep our local fact-based journalism running. GBH's vehicle donation program takes the hassle out of your hands and clears out your driveway heading into these long winter months. And we're not just talking cars. It can be trucks, motorcycles, RVs, even boats. When you donate your vehicle, you'll also be eligible for a possible tax advantage. Learn more at gbh.org/vehicle donation.
You're listening to 89.7 WGBH HD1 Boston. Online at gbhnews.org.